Doctors overread it. What's the most outrageous self-diagnosis that you've heard from a patient? A doctor here. I had a patient insist she had a fever once, and when I pointed out that our thermometer did not record a fever, she told me, "I'm not sure they taught you this in medical school, but when Asians get a fever their temperature doesn't go up." Yup, I missed that lecture. At the psych hospital, we had a difficult patient, violent, making wild accusations, completely psychotic. During treatment team meeting at the psych hospital, when we were working out her treatment plan, she suddenly started screaming that she'd gone blind, that she couldn't see, and if we cared anything about her we'd help her. This time, she had a point, though. The lens of her eyeglasses had fallen out and landed in the breast pocket of her shirt. Had a patient come in once due to weight gain that she thought was due to being pregnant. Made sense, except she'd taken more than half a dozen pregnancy tests and they were all negative. She was convinced she was pregnant though, and wanted me to check. I tell her okay, I'll do a blood test, since we can detect pregnancy earlier with that, and she refuses. Says that she just wants to pee on the stick in front of me and have me read it. So I say sure, and lo and behold, it's negative. Little more questioning, and it turns out she'd been eating literally nothing but chicken wings for weeks. When I asked her why in the world she would do that, she replied that she just really liked chicken wings. A reasonable response. I had a patient a few weeks ago who was in her late 80s come in worried about having a sexually transmitted disease. She goes on to tell me that she hasn't had sex since her husband died in 1994. I am an allergist. Very appropriate username. My mom took my sister and me to the doctor when we were kids because we had weird bumps all over the back of our tongues. We were diagnosed with tastibods. This is my favorite. Somewhere, I have a picture of my favorite clinic note I've ever written. For context, SOAP stands for subjective, what the patient says, objective, what I see, assessment, and plan. It goes, S, bumps on tongue, unsure of when they appeared, asymptomatic, O, tastibods, A, tastibods, P, reassure. Vet student here. I've had some dude with a super aggressive dog diagnose the poor thing with neural instability, causing his aggression, from an online consultation with a homeopathic shaman. He then came into the clinic with instructions from the shaman that he wanted the vet to carry out, including rubbing the dog all over with a $200 healing stone. Despite the fact that the vet had obviously the more reasonable explanation, he didn't want to believe leaving a dog in the backyard without much human-animal interaction for most of its life could cause aggression. Go figure. Pharmacist here. I've had more than one patient run to me screaming that they looked up their rash on WebMD and must have Stevens-Johnson syndrome. Actual diagnosis: contact dermatitis from laundry soap. For anyone reading this, do not Google image search for that syndrome. And family practice mid-level here. Had someone come in one day saying they had wires and fibers under their skin, including a little Ziploc bag of, you guessed it, wires and fibers that they had pulled out, he said, with a needle. Now, this is Morgellons, a well-known psychological entity, but to see it so blatantly like you read about in the textbooks just blew me away. He actually believed it. Very unsettling. Paramedic here. Technically not a doctor, but here goes. Walked in the door to a young male with chest pain. As I walked up to him and introduced myself, he said, "I have pericarditis." I felt like telling him, "I'm not sure how you would know if you did, but we'll run some tests and see what we have." Put an ECG on. Took him to the hospital for more tests. We found out the final diagnosis by the hospital staff was, surprise surprise, pericarditis. So there you have it, the patient was right. I still have absolutely no idea how this kid knew that. I work in physical therapy, and once had a guy with dementia say, "I know I'm in pain, but I just can't remember where." I felt bad for laughing about it later, but I had never heard something like that. Guy comes into my older one day with a nail in his hand from an accidental discharge of a nail gun. Nurses checking him in and asked him to rate his pain on a scale of 1-10. He replies that it's only about a 3. We all look at him like he's nuts because our pain is at a 5 and we're just looking at him bleeding. Plus, this is a charity hospital where 99% of the patients are sitting in bed, casually texting or chatting on the phone, but still rate their pains as 10/10. You get the picture. So, the triage nurse rolls her eyes and asks him how it could only be a 3. He responds by saying that one morning he was cooking his girlfriend breakfast. They were especially hungry that day because they had just been a bit frisky when they woke up. Since they had just finished, he wasn't wearing any pants. Well, he says that when he bumped the pan and the hot bacon grease spilled onto his testicles, that was certainly a 10/10. So, to him, a nail in the hand only rated a 3/10. There's a man who knows a 10/10. Kinda opposite to what everyone is saying, but once saw a guy with a foot that looked like death, probably untreated diabetic. He only went to the ER because his sons dragged him. He literally had his foot inside a plastic bag. Bag was tied around his ankle. Because of the smell, he insisted he was fine and to be let go. The amount of horribly sick patients that think they're just fine is too dang high. This reminds me of that one time my grandmother didn't want to cause trouble by going to the hospital when she had a freaking tachycardia. 170 plus beats minute. Psychotic patient tried to convince me he had kittens playing inside his chest. Not so much. The atrial fibrillation and palpitations were real, though. The cutest diagnosis. Seizures from a parasite. He was actually psychotic and was self-treating what he thought was a parasite infestation by drinking household cleaning agents. When he started seizing afterwards, this reconfirmed his parasite diagnosis in his mind, so he drank more. Dentist here. 27-year-old patient comes in with mother. Mother is on disability. Patient has large amounts of decay on every single tooth in his mouth. Kid absolutely will not even listen to having his teeth pulled and dentures placed. Public health office, so most are uninsured, low financial status. Really should have most if not all of them pulled. Agreed to do a mock-up treatment plan which came out to roughly $4,500. That's with a sliding fee discount of 50% for the lowest financial level. They agree to pay. Mom plunks $800 cash down for root canal to start off. I ask what happened for his teeth to get that bad. Stupidest answer I've had yet. A dentist before told me to mix dollar store mouthwash with peroxide and rinse with it. It absolutely wrecked my teeth afterwards. Mother agrees and swears that same thing happened to her husband. Older brother is getting all of his pulled. My wife is a veterinary nurse. Someone brought their dog in because of small growths and 2 lines along the dog's belly. The dog was diagnosed with nipples. Not a doctor, but work in the newborn intensive care unit. One night we were called to labor and delivery for a preterm delivery. Not a mom called 911 because her stomach hurt a lot and she thought she was dying. At the hospital it was confirmed she was pregnant and in labor. The whole time we were there she kept saying she was dying and why wouldn't we help her. OB key telling her she was in labor and to push each time she felt pain. She kept yelling, "It's just gas. I've had gas for a while, but it won't come out because I'm dying." Fast forward to baby coming out. OB hands the baby to the nurse who then shows not a mom her baby. Not a mom says, "That's not mine. I have gas." Nurse places the baby on her chest and says, "Well, here's your gas. It's a boy." This sounds like an episode from a TLC program. I no longer have cable. Patient told me she knew it wasn't a heart attack this time. It felt different than the last 19 times she came to the ER which weren't heart attacks. She was half right. It wasn't the same as the other times. She died. My elderly friend is the queen of self-diagnosis. She tells the doctors her prognosis and rarely follows through with their treatment for her actual issues. My personal favorite is that she produces too much electricity. Because of this she has issues with anything electrical, namely computers, cash registers, pin pads, and my personal favorite, gas pumps. She is afraid she will blow up the pump, so I fill her tank for her. In reality she is confused by technology and never wears her glasses. She was recently put on vitamin D pills because she rarely goes outside. Her house is basically a black box inside. I'm afraid to find her wrapped in foil one day. Not a doctor. Once had a patient come in who was convinced he had colon cancer. He was just constipated. Had an overweight young woman come in saying that she was pregnant and the baby's foot was protruding out of her vagina. We get her back quickly, start a set of vitals, and she is terribly calm about the whole thing. Ended up she was not pregnant at all, just crazy. An older gentleman came in complaining of headaches. During his history, he became agitated and kept insisting that the government had been experimenting on him by dusting his house, food, water, etc. with anthrax. He was quite certain that there was anthrax in his brain because he could see it in the back of his throat. Turns out he just had an upper respiratory infection. So, same thing I guess. Posted earlier things my patients as a paramedic told me, but this one is mine, albeit in reverse. Finally went to urgent care one night after several days of severe abdominal pain. Doctor insisted that it was appendicitis, despite my insistence that I do not, in fact, have an appendix. He was thoroughly confused when he couldn't find the appendix with the ultrasound. Cue looking for my gallbladder, thinking gallstones, swing and a miss. I'm missing my appendix because they took it out along with my gallbladder at 5yo due to gallstones. I went to the doctor once with stomach pain, and the doctor thought I had appendicitis and sent me to the ER. Turned out I was massively constipated. Medical diagnosis: I was full of crap. Not a doctor, but I was in the ER in college in New York City for some crazy stress. I think I was over caffeinated and had not slept in 2 days from studying. But anyway, I ended up just being dehydrated and they gave me an IV and let me hang out there for a while. In the background I kept hearing this guy yelling, "I'm gonna faint. I'm gonna faint," and it seems pretty legit. So I was getting worried. Finally, he yells it out one more time, and a doctor walks by and says, "Mister, you're in a hospital bed, so if you faint, I think you'll be okay." I once had a girl who said she had syphilis because she got like this ulcers in her mouth, which were coming and going, and she said she had zits on the back of her tongue. I looked and it was her taste buds, no other lesions to be seen. I told her that primary lesions in syphilis almost always cure completely, so if those ulcers were appearing and disappearing every once in a while it was very unlikely. By that point she had gotten a lot more relaxed and the consult went great and she went home feeling a lot better. Still, I made her get an STD panel because she was sexually active, young and in doubt of her partner. Next consult she shows up saying, "Doc, I think I do have syphilis." She did. I learned a valuable lesson that day. Cool thing was she wanted to do her treatment and follow up with me because she told me she had seen a lot of people before me but no one bothered to check. As a resident I had one patient wait in the waiting room for 8 hours for painful lips. Diagnosis: chapped lips. Prescribed chapstick. Another patient waited the same amount of time in the ED waiting room at the County Heckhole Hospital. The reason? Mosquito bite. One stupid mosquito bite. He said he was a hemophiliac and was afraid he would bleed to death. Dentist here. I had a patient come into my office, absolutely certain he only had gingivitis and needed a normal cleaning. All because he had googled his symptoms and believed he could get a normal clean and go back home and do oil pulling after, which would somehow miraculously heal his gums. Would not allow me to take X-rays or deep clean his teeth, which he needed because plaque was formed well below his gums. He even told me his gums were bleeding from just smiling, moving his mouth, etc. He insisted on just a regular clean and then accused me of trying to make money off him when I basically put my foot down and said I wouldn't be working on his mouth unless he allowed me to do my job properly. I was glad when he decided to walk out and never come back. I once had a middle school band student who had to miss a rehearsal because she had bruises all over her legs. The doctor's diagnosis: unwashed blue jeans. I had a woman once that was convinced that someone was trying to steal her Klonopin, so she ate all 45 of them. We try to get her to drink AC so that we hopefully don't have to lavage them out. She fought us over that because now we were the ones who were trying to steal them from her. That was on a rotation in paramedic school. Another was the woman who swore she was having a heart attack, despite not having any symptoms at all. We did the EKG and full workup, which unsurprisingly came out completely normal. She insisted, so we transported her anyways. I apparently ran all their tests and discharged her when they were clear. 3 hours later, guess who calls? She's still convinced she's having an MI and wants to be transported to another hospital. She was politely told to frick off. Found out later that she calls once a week or so. Unrelated but funny was the old man who called us out because he couldn't find the TV remote and his son was asleep. Doctors, when did a patient's lie nearly end up killing them? Middle-aged housewife comes to ED with episodes of headache and collapse, vacant episodes, usually early hours of the morning. Has the full workup with CT scans and lumbar punctures several times, always negative. It took several attendances before anyone asked her about recreational drugs. She was an unassuming suburban mum. Turns out she was into C in a big way, leading to reversible cerebral vasoconstriction. No more C equals no more headaches, and no lasting consequences luckily. Not a doctor, but I was in the ER once, separated from another patient by only a thin curtain. It was impossible to not overhear what was going on. She was an elderly woman who had taken an ambulance and due to feeling faint and said she had no other symptoms. Hours are going by. She gets up to use the washroom a couple times and makes small talk with her brother, sounding pretty woozy the whole time. Doctors keep checking on her. They draw blood and check her blood pressure. I think it was like remarkably low, but they aren't sure why. Cut to several hours later when a nurse notices there's some blood on the woman's bed. After some back and forth, she finally admits that she had been bleeding profusely from her rectum for weeks. The doctors gave her a hard time but got her out of there real fast. Yikes, booty blood is never a good sign. Paramedic here. One common one is when older guys are having chest pain and we want to give them nitroglycerine paste pills to help the chest pain. One thing that doesn't mix well is nitro and Viagra. It causes a blood pressure drop that can be really dangerous. We always ask and make it really clear that if we give the nitro and they are taking Viagra and similar meds that they could die. It usually takes 3 or 4 warnings in a row before the guy will admit it. Early on I made the mistake of trusting a guy after just a couple mentions of how dangerous it would be. I sprayed the nitro under his tongue and he said, "Does generic Viagra count?" Frick. At one point his BP wasn't even registering on the box cuff. It was bad. I thought I was going to get screamed at by my doctor, but he just laughed and said it was so common that he wasn't upset, and gave me a couple ideas on how to make it clear how dangerous it was to the patient. I work in outpatient surgical center. Lying to anesthesia can be really dangerous. I've had a person lie about not taking drugs and then react badly when given the anesthesia meds because they interacted. Fortunately for that patient, not nearly dying, but I will forever have it ingrained in my head, the anesthetist leaning over their head screaming, "What drugs did you take?" And to that I fortunately haven't seen serious event, but definitely has happened to our providers, and I've seen more mild versions. People eating, drinking before the anesthesia and then denying. Lucky for my patients they just have puked after waking up, so we know they had it but made it okay. The danger is you can puke during sedation and then get it in your lungs, called aspirating, and die from that. Could be really bad, but fortunately I personally haven't seen the worst yet, but I've heard plenty of stories of it. Not a doctor, but my sister's godfather was diabetic. He went to the ER because he had a really bad cold for like 2 weeks. He went in and they asked him if he was a diabetic, and for some reason he said no. Long story short, they gave him something that made his sugar levels go up and he went into a coma. He died about a month later because his organs shut down. A hypo can give him delirium, which may have caused him to say no. When patients lie and say they haven't eaten anything prior to elective surgery when they have. I caught a patient snaffling biscuits that her partner had brought in for her because we are so cruel to deny her food. People can die from aspirating stomach contents during a GA. I didn't drink or eat for like 8 hours because I might have surgery that day, didn't have it until 2 days later. I didn't drink or eat all day because I went surfing in the morning and broke my leg, and the people at the hospital didn't let me touch anything just in case. One of my relatives had a bad reaction to amoxicillin as a child. Puffy face, trouble breathing, emergency room visit bad. Fast forward 15 years, she's off at college and has come down with some sort of infection. She, however, didn't inform the campus health people because, and I quote, "allergies are caused by a bad diet, and since I'm a vegetarian I shouldn't have them anymore." Yet, they prescribed her amoxicillin, and, if it weren't for her roommate being home to call an ambulance, she'd have been dead. Well, at least that wasn't a lie, just freaking stupid. I wasn't the lead on this case, but I was the assist. When I was in dental school, this patient came in and was really hyped up. My buddy asked him if he has been on any drugs and the guy just said he had a lot of caffeine. Okay, we move forward. From what my friend told me, his blood pressure was high, but not too high for an elective procedure. Part of the local numbing we give patients has epinephrine in it, and sometimes this gets into the bloodstream with certain types of nerve blocks. Not uncommon. However, if you've snorted a couple lines of C and then get EP in your bloodstream, that's no bueno. Ended up calling the ambulance. His BP was so high he was at risk for a stroke. So yeah, even stuff the dentist does can kill you if you lie. Every dentist's office I've been in as an adult has had a poster on the wall in the waiting room warning about this exact same thing. Here's a fricked up family story. We had an 81-year-old frail grandmother brought in by family for failure to thrive in the setting of incurable stage IV colon cancer being cared for at home. Patient was admitted awake and conversational. Poor historian. Complaining of pain. She proceeded to gradually get sicker, shut down like she was dying, becoming gradually nonverbal, unresponsive, and dropping vitals. She was DNR, so we did supportive care and looked for causes such as UT, SBP, sepsis, liver failure, etc. The family was around the whole time, acting very involved and caring. 36 hours later she gradually started coming out of it, before recovering back to baseline. It turns out she was given her home dose of morphine in the year prior to admission, which was 100 mg extended release morphine, twice daily, as she had been complaining of pain. Her family had failed to mention that they'd been diverting all her pain medications. That nearly got their grandmother killed, as we had no reason to suspect an opiate as the cause. That reminded me to always consider opiates. We discharged her to a long-term care facility. Not a doctor but an army combat medic. We were in a small firefight and a soldier was hit in the leg. It was very easy to see the wound because of the desert camo doesn't blend in well with blood. The part that almost killed him is he never told us that he was hit in the chest. We asked him and he said only in the leg. I knew he was lying because he was holding his chest too. But I didn't want to make a bad situation even worse, so I didn't say anything. But when we asked him again and he said no, I didn't want him to die of course, so I pulled his plate carrier off and we did more medical on him. He definitely would have died from that wound. It punctured his lung and he was having trouble breathing. We called for a medevac and he lived but with only one lung. Never knew it. He joined the ALA again but I assumed he stayed out. A lot of them I get. This one, no way. I guess it is the stress from combat because I can see no way how a sane person could believe this lie would somehow help him. I see he might have wanted to stay in combat, but still it's your chest. There's quite a bit of things you need in there. I work in an STD clinic, so the stuff I deal with isn't usually deadly, or at least not immediately deadly. However, I am constantly surprised by the percentage of patients who test positive and refuse to tell their partners. A guy came in a few years ago who for something relatively simple like gonorrhea, but seemed to have trouble walking. Long story short, a nurse called an ambulance for him and sent him to the ER for a spinal tap. Turns out an ex-boyfriend refused to tell him about his syphilis diagnosis after they had a rough breakup like 15-20 years earlier. So not only was our guy possibly spreading syphilis unknowingly, he now had untreatable neurosyphilis. He worked with our disease intervention specialists to track down as many partners as they could, but I think he died from related complications like a year after his initial visit. That's just heartbreaking. We had a patient that took her home heart meds religiously even in the hospital when we were also administering them to her. She was educated to not take any of her home meds while she is hospitalized since we're giving her the hospital meds. She would sneak and take them. Her blood pressure bottomed out and would have to bolus her. Security was called and had to remove the meds from her and lock them up. We had another patient requested a sleep med. The nurse gave it to her. Later, found patient barely arousable and blood pressure dropped, which did not make sense. She was given a low dose of sleep aid. Patient had her purse open on the bed and found a prescription of Ambien. The patient took our sleep aid plus double dose of her home med Ambien. We always instruct patients on admission not to take their home meds while in the hospital. We are not allowed to go through their belongings due to privacy. Edit. Grammar. My, well, step-uncle. Brother of my stepfather. Never met him though. Lied about being in pain sick so he could stay home from school and miss a test. Kept upping the ante so they'd believe him. Apparently his parents were pretty strict and he was terrified to admit he'd lied. Long story short, they took him to the hospital. He was diagnosed with appendicitis, and they straight up cut him open. The test was looking pretty good at that point. It was pink and perfect, and I dropped it in the scrap bucket. I was admitting patients in the psychiatric ward. Busy night, and I was way behind. An older man with schizoaffective disorder is admitted with a caretaker. A nurse asks them a few questions, including if the patient has taken any medicine and/or narcotics. The caretaker says no. I see the patient 4 hours later. He seems delirious, which often is caused by a somatic problem, including medicine. You know where this is going. He can't maintain eye contact and can only sit in his chair and talk nonsense. He drools and yells every word, but somehow seems very tired. I ask the caretaker if the patient has taken any medication, and she says the patient broke into a medicine room at the institution he lives and just started eating random pills. Apparently this is somewhere around 80 pills, not being more precise because she did not bother gathering the empty pill boxes. The only information I could get was that he definitely ate over 40 lithium pills, which is just great if you really hate your kidneys. Now, after calling the emergency department to quickly prep and an ambulance with an anesthesiologist for transport, I talked with the caretaker, through my teeth, just slightly angry. Apparently the nurse wouldn't understand because it wasn't his own medicine and she didn't want to make a fuss. I screamed into my pillow that night in pure frustration. I later found out he lived after intensive care and almost losing his kidney function. That caretaker deserved to lose her job, and probably some sort of legal criminal action. When someone in your care eats pills and you know about it and then tell a medical professional that they didn't, you are endangering the life of another human being. Don't freaking mess around with that crap. Had a grandma who was basically comatose status in her. Whenever we could rouse her or get a word she stated she wasn't on any drugs, we YOLO gave her Narcan, narcotic or drug, with no effect. 20-30 minutes later we do flumazanol romazicon, benzo or drug, and she wakes up. A lot of PPL weren't suspecting her of drug OD given her age and statement, so they were thinking 900 different routes. In programming we call that shotgun debugging. When we do our pre-op check before a surgery, our office prints out a list of meds we have in file that the patient is taking. We tell them please look at this list and sign it to indicate this is the current and up-to-date list of the meds you take. Patient signed and we plan for surgery next week. Get a call from anesthesia the day before her scheduled surgery. Apparently she forgot to mention she had started taking a weight loss drug that if you're taking it, can cause severe hypertension when you go under anesthesia, and in extreme cases you can die from that. You have to have stopped the drug for at least 4 days to be safe to have anesthesia. So her surgery got pushed back a week. Not cancelled, just pushed back enough to be safe. She called our office fuming and demanding a refund for the time she took off work. Seriously lady? Sorry, but we have a signed document saying you told us all your meds. Exactly who should be mad at who? You put us at liability and now the surgeon our office doesn't get paid for that day when we could have subbed in someone else in that slot. My cousin isn't a doctor and sees this quite a bit. Mostly people lying about having done drugs and underage drinking because they don't want to get in trouble, not understanding that the doctors are less concerned with that than they are making sure the person's lives. One particular incident, the person had drunk quite a bit and done several kinds of drugs but wouldn't admit to it, and came in alone, so there was no one to verify what had happened. Because this person wouldn't admit to the drugs they'd taken, and thus wouldn't tell the docs what they had taken. They had no way to help and could do little except watch as this person slowly died from the drug and alcohol interactions, because without knowing what was already in their system, giving them anything could have only sped up the process. The person was a minor and passed away from massive organ failure because they were more worried about getting in trouble than saving their own life until it was far too late to admit the truth. I was a LNDRN. My co-worker had a patient show up in labor. She was 6 centimeters. I was helping get the room set up for delivery, and the patient's mom started to ask her, so does that mean the baby? And the patient violently shushes her. Her doctor wasn't on that night and that office didn't have electronic records we could access at night, so we're just going about prepping for this delivery. When her doctor happened to come into the nurse's station because she had to come in for a medical patient on another unit, she just stopped by to chat, but noticed that patient on the board and asks, "Oh, so her baby actually flipped?" Turns out the kid had been breech all pregnancy and was still breech. She didn't want a C-section, so she figured she'd just try to come and so far dilated that she could just deliver. That would have been okay if she was frank breech, but down, since it wasn't her first baby, but she was footling breech, crossed legs with feet down. That's dangerous as heck, because it's super easy for the umbilical cord to come out first instead of the baby, which cuts off baby's oxygen. My fourth was head down and this ended up happening to me anyway. Emergency C-section in less than 10 minutes. Her baby was so lucky her water hadn't broken, especially if she'd been at home still. She still kept refusing the C-section, and my co-worker finally snapped. We had another patient who was in for a stillbirth and had a lot of family down in our waiting room trying to process what had happened. My co-worker asks if her patient had noticed all the crying people at the end of the hall as they were mourning their dead baby, and would she rather have a C-section or deal with the grief that family had. She finally got the stupid C-section. My co-worker caught a lot of flack for checking that patient and not noticing she wasn't feeling ahead. Not a doctor, but my dad's a paramedic. He's told me plenty of times about when patients have told him they've taken Ziz drugs when they've been doing illegal drugs to avoid getting into trouble, and he's administered drugs which just make it 10x worse because of the combination of them, and he can't do anything else other than just take them to the hospital if they're still breathing. The most frequent one is that they don't need a specific antibiotic or other life-saving drug because it is really just too expensive for them to afford. The fault is mostly with the drug companies. They find out they are the only ones making a specific drug and they raise the price just because they can. Then the insurance stops covering it and the doctors may not learn any of this until the pharmacies start calling his office to get the drug changed to something else. But there is no telling how many people die or suffer serious health problems because of the drug and insurance companies' greed. A lot of people get less than ideal treatment simply because of these middlemen trying to get their cut. It may please you to know that in Canada, the government regulates how much a company can charge for medication. As a result, medicine prices are just 10% of what you would pay in the US, and in some cases just 1%. It is amazing what happens when the government is for the people instead of the corporations. I'm an NP in a medical IQ. Probably my most consistent is people lying about their drinking habits. I could give less than a crap if you pound a bottle a night. I just need to know so I can be ready for you to start detoxing on day 3 and have the right meds and cues so you don't have a seizure, aspirate, etc. I always make this abundantly clear, and I am not the morality police. Yet, every year we have a few come in with very fixable problems, lie about heavy drinking habits, and ultimately die in the hospital from complications secondary to their withdrawal. My teenage brother had the opposites to most of these stories. He came home after being out drinking with friends, raided the fridge and went to bed. A little later he comes out panicking to my parents that he's having trouble breathing, is feeling dizzy, and has a bunch of other alarming symptoms. They rush him to the ER and from what they tell me the staff were yelling at him to tell them what drugs he'd taken, even though he was adamant he hadn't taken anything. They wouldn't believe him. My parents were begging him to tell them, but he insisted he hadn't. I'm not sure of the rest of the details, but it turns out he had developed a nut allergy he wasn't aware of and had eaten something that was causing him to go into anaphylaxis. Well dang, that was a huge stretch of the doctors to assume. Didn't even think to see what he had at least eaten before yelling at him, "What drugs did you take?" Social worker at a children's hospital. We have kids coming in through our resuscitation room that have been seizing and are unconscious with no prior history. I'm constantly trying to get parents to tell me if there is a possibility that their toddler might have ingested something. Does your kid have access to cannabis? Could they have eaten some? Parents never want to admit it to doctors, and so I'm always on a fact-finding mission. As a social worker, parents are either glad I'm there or they think I'm going to take their kids away. Cannabis can affect children in horrible, shut down your ability to breathe kind of ways. My 1-year-old niece died from cannabis. Poor thing had no chance to live. Not a doc, but worked in EMS for a handful of years. We would get overdose patients who definitely don't use drugs yet respond to Narcan. Had a relative that went in for surgery on his stomach. There were holes in the lining that were caused by painkiller abuse. No one at the time knew what was causing this except for my relative. Doc asks him if he was on any medications. Relative says no. They put him under. He didn't wake up. His toxicology showed oxycodone and hydrocodone. Don't lie to doctors. They don't tell anyone about your medical problems anyways. One of my patients was smoking in the bathroom while on oxygen. Could have ended very badly for him and others in the hospital. I'm not a doctor but a patient with a couple of really weird disorders that cause doctors who aren't familiar with them to think I am taking. I have been denied very needed basic treatment like a bag of saline because my dehydration is exasperating my symptoms because they think I'm somehow gaming the system. These assumptions that patients are lying do a lot of harm. 2. I have a story about someone's lie that did end up killing them. About 10 years ago my best friend's ex, David, bought some ecstasy for himself and his big brother, John. The ecstasy they bought was laced with something bad but they didn't know that yet. They each took one and John started to OD. David, wanting to save his big brother, called an ambulance. It showed up and David explained what happened. They loaded up John and they asked David if he also took the ecstasy. Because he didn't want to get in trouble he lied and said only his brother took the bad ecstasy. Ambulance left with John while David started to OD minutes later. John was taken to the hospital and survived. David died alone at their house. Such a dumb accident but so sad nonetheless. I think John still struggles with the guilt of the death of his baby brother to this day. How about the opposite? I've moved a lot and when I visit a new doctor they often try to answer my health history for me. Drinking, smoking, exercise and diet. Men, you're thin. So moderate. No. Regular. Healthy. None of that is accurate. But when I correct them I get oh. So is this a cry for help? What number? I just want you to have the facts. I'm not a doctor but my friend went to the dentist for an emergency root canal. The dentist asked him if he had done any kind of drugs in the last week because anesthesia they needed to put him under would kill him if he had done any form of C. He lied. The dentist was about to put him under when my friend finally came clean. My dumb butt friend nearly killed himself because he lied to a dentist. Jesus. Nurse here. We don't care. We don't care about your history, your finances, your social scene, your anything. We just want to help you. Christ. We really don't care about anything except that you are a human being, and we want to help you. Please people, tell the truth. It will save your life. Doctors of Reddit, what was your dumbest RIM Verismit patient experience? Not an MD. I'm an RN that works with oncology, cancer, patients, some of which are on clinical trials. I got a patient and, before starting his chemotherapy, reviewed some of his lab work with him. I told him his glucose level was 73. Normal range is usually between 70-100. He got really upset at this point and asked him what's wrong. Your labs are within range and he said I need it to be 0. I said, what? Why would you want your glucose to be 0? He said he's trying to meet requirements for a new clinical trial that requires his glucose to be 0. I told him, I don't know what clinical trial you're trying to get into, but if your blood glucose was 0, you'll be dead or dying. He was not convinced because I'm just a nurse, so I sent a message to his MD asking them to educate their patients better. Paramedic here. Transported a guy who was adamant about only using homeopathic medicine, natural healthy living, etc. and refusing meds interventions x-rays on this basis. He also smoked a pack a day. The ED doc called him on this nonsense with something along the lines of you smoke so you're not at homeopathic, you're getting a chest x-ray. Just got this story from my girlfriend's stepdad who is a neurosurgeon. He had an OBGYN friend who had a couple who couldn't get pregnant. Apparently they had been raised in some religious fundamentalist cult and didn't understand how sex worked. The guy was just rubbing his penis against her leg and ejaculating on her thigh. I had a 350 pounds patient late 30s, brought in by his sweet old mother because she was concerned about his recent sweats and shakes. Tell me about his high IQ of over 140. I just nodded and ordered a blood panel. When I got back in the room with the results, he was trying to tell me how he knows more than me about everything to do with medicine. I told him I was diagnosing him with new onset diabetes. He couldn't tell me anything about the pathophysiology of diabetes. Then I asked him which IQ test he took and how old he was when he took it. He said it was an online test a few years ago, like on Facebook. He didn't know what a Stanford Binet test was. Had a patient with a HbA1c of 13 who refused all diabetic medications because he believed that he could control his liver's production of glucose with his mind. He believed himself to be very fit and active and felt that with his mental control he was a better athlete than most other people because he could ramp up his glucose production when he needed to. He was in the hospital for a diabetic foot ulcer that required a transmetatarsal amputation. A male patient injected kitchen oil into his own cheeks because he saw a plastic surgery TV show where a surgeon injected something similar to a model. Then he was amazed that the bumps of the oil didn't go away and were turning red and painful. Anytime someone refuses to vaccinate their kids. Here's just a small sample of some of the reasons I've been given. 1. Causes autism. 2. Made from aborted babies. 3. Big pharmacy scam. 4. Unnatural. 5. My kid cried when you gave him his vaccines last time. 6. I never got these diseases as a kid, so my kid doesn't need the vaccine. Seriously, frick you people. I feel sorry for your kids. Also, don't forget I've done my research followed by a strong smell of smoke that emanates from them because cigarette smoke isn't dangerous to kids. I've seen that more times than I'd like to admit. Was treating cavities on a very nervous 4-year-old. Had finally gotten into a cooperative groove when Genius mother looked up from her phone and noticed that I was drilling teeth. She was in the room the whole time. I had reviewed treatment with her. She knew we were fixing cavities. Proceeds to curse me out under her breath saying you're drilling holes in her teeth. This is freaking ridiculous. You people are scammers making holes in people's teeth. I kept my calm and said, Mom, if you have questions I will be happy to answer after I'm finished. I'm shaking with rage at this point because she was 20 minutes late to her appointment and I'm bending over backwards to make sure her kid has a good visit and doesn't end up scared of the dentist. Appointment is over. Kid jumps down, high fives and gives me a big hug and I turn to Mom and ask her how exactly she thought cavities were fixed. She said you don't drill. My mother is a dental assistant. I then proceeded to explain in excruciating detail the scientific process of how we remove decay. She said that's not true. I then told her that she can go ask her mom, ask Google or go to dental school if she wants to know more, but I won't be treating her child anymore. Freaking nutbag. I don't know if this fits perfectly, but a while back I helped open an urgent care for the first 2 years. When we first opened the doors, one of our first customers was an 85-year-old adorable Asian lady who was really hard to understand but talked a lot. Anyway, this lady comes in for the first time complaining of a stomach pain, which we attempted to diagnose her with something, but nothing added up for about 30 minutes to an hour of her talking until she finally told us she just felt better. Okay. So we don't really mind it until next week around the same time she shows up again with the same problem. And guess what the solution was? About 45 minutes of listening to what she ate for dinner the last few nights. I think we eventually figured out corn was messing with her, but this never deterred her from coming in more. This eventually became a once a week occurrence, then a once everyday thing, until we finally started becoming a busy urgent care and we couldn't really fit her inside our schedule. I guess it wasn't really an I am Verismart experience, but I swear this lady actually came in every day thinking she was on the verge of death, until we had convinced her she's fine. In case you're wondering, I'm almost certain she's well over 90 now and still going. Another possibility is that she's faking and just wants someone to talk to. Anytime a patient comes in who is deathly ill and clearly needs antibiotic, cholesterol, blood pressure, etc. meds to get better that tell me I'm not taking the medicine. I know you just prescribe those because the drug companies pay you. Yes, sir lady. All of these drug companies are giving me dollar bills y'all to put you on an antibiotic, cholesterol, blood pressure medicine, etc. Right. I am an ent. I had a patient call me on the weekend once and the conversation went like this. Me, yeah, this doctor, with ent. Some guy, well, my testicles really hurt. I was sure this was a joke. Dude, I am an ears, nose and throat surgeon. Some guy, yeah, I know. I am being treated for a chronic cough. Me, okay. Some guy, well, you know how when you go to the doctor and sometimes they put their finger down there, Tell you to turn your head and cough? Me. Yeah, they are checking for a hernia. Some guy. So you think me coughing is why my balls hurt? Me. No. Some guy. You sure? Me. How bad do your balls hurt? Yes, I said balls to a patient. Some guy. I can't even put on my underwear. Me. Go to the dude. A related story from my friend, a gynecologic oncologist. Basically, a woman had early uterine cancer, but refused surgery. She wanted to explore alternative treatments like coffee enemas and meditation. She somehow managed to get an audience with the Dalai Lama, who told her to go back to Western treatment. This is a story, as told to me by one of the M's in the area. Had a guy present to the requesting an ice chest, ice cooler full of ice. After a lengthy discussion, this is the narrative sorted out as the story was erratic. Guy went to party. Guy met gal. They had fun dancing. She asked him to her place. She asked for some sexy time. She asked to kick things up a notch. He said, why not? She pulled out a syringe and injected a drug into his dong to make him have a harder and longer lasting erection. They proceed to have lots of fun sexy time. A few days later, things are sore. Something's not quite right in the dong. Some red spot starts getting redder, larger, and darker across time. Things start turning black and smelling bad. He decides it's a good time to take some initiative, so he pulls out a knife and starts sawing at his dong to carve out the dead skin. Then, he hits a nerve. At this point, he changed his mind to see if he can fix the issue and covered it in olive oil, then wrapped it in saran wrap. You know, to fix it. Some more time passes, and he goes to the bathroom in a restaurant. He pulls down his pants, and his dong slides off of his pee-tube, urethra, like a corn dog off of a stick, and lands on the floor next to him. He picks up his dong, goes and gets a cup from the vending machine, fills it with ice, and puts his dong in it, to help keep it fresh. He wanders around for a few more days, then decides that his dong cup is getting too smelly, so he goes to an and asks for an ice chest full of ice. He gets taken to the ER. The docs consult urology, and it turns out that when he goes pee, it just flings around everywhere like an unbridled fire hose on full blast. The hospital won't let him keep his dong, as it is a biohazardous tissue at this point, but he won't let the hospital take it until they decide to give him a receipt for a dong. Then the dong is taken to wherever they incinerate dongs, and the dude wound up admitted with a surgical uro consult. Moral of the story: don't inject crap in your junk, even if it is from random strangers for sexy time. Jesus Christ. This one happened to my ex-father-in-law, and it's funny, but it's not. He was a surgeon, very gentle, soft-spoken guy, and came out to tell them the biopsy results. To which they responded, praise Jesus, it's malignant. He had to explain that malignant meant bad. Honestly, that's freaking hilarious. Not for the patient. I'm still just a medical student, but our hospital sees a lot of poor and poorly educated patients since we're a big tertiary hospital in a developing country. Worst I've seen so far are the old ladies who everyone in the family turns to for health advice, their only qualification being seniority. They usually have a bunch of superstitions that end up contributing to the patient's condition in the first place. I once saw a neonate brought to the ER for a really bad oral infection, and the mother clearly hadn't taken a bath since the delivery. It's a common superstition here that mothers shouldn't take a bath a week or so postpartum, so we figured that's the source of the infection. While we're assessing the patient, the doting grandmother in the background decides she has to comment on everything we're doing. Remember, she's probably the one who advised her daughter not to take a bath. I just had to shut her down because A, it was late and people were running out of patients in our understaffed, under-equipped ER. B, they're more worried that pulse oximetry is hurting the baby's tiny whittle toes when there's freaking pus leaking out of the baby's very inflamed salivary glands. I mean, I get that infections like these are a disease of poverty, that their poor education is just indicative of a wider systemic problem that Philippine society fails to address time and again, but by golly does it get annoying. I told a patient's mother that his heart rate sped up in response to pain as a physiologic response. She exploded at me and got very confrontational. Turns out she thought I was saying it was psychological or all in his head. TL. DR. Don't use big words. No, He didn't have a water allergy. That's impossible. He had vomited one time after drinking a lot of water and thought he was allergic to it. Lady walks into the office. I start coughing. The smell of cigarette smoke is so strong on her. Her dry leathery skin cracks while she talks from the years of sun abuse. She tells me, I've stopped using sunscreen because I researched that it causes cancer. Poor old man with an unresectable brain tumor, glioblastoma, was in the ICU after surgery to debulk the tumor. His family included a pediatrician and a cath lab technician. The pediatrician daughter kept trying to get us to give the patient some homeopathic BS medicine that she brought with her because I work at Harvard and we use it all the time there. I'm surprised you don't have it here. I seriously doubted she was truthful about where she worked, and I 100% guarantee that if she worked at any reputable practice they were not treating kids with whatever crock homeopathic BS she was pushing on us. Unless I actually saw her credentials, I doubt her medical credentials. I have had a few family members try to pass along their internet medical degree as an education. Optometrist here. Had a 38-year-old female patient coming in for a routine eye exam. Asked her all the usual background health questions. Saw she had checked off migraines x 20 years on her health history. Whenever anybody mentions they have headaches I always ask for more details. She said she's had migraines every day since high school. I was a bit confused. I said every day and she said yep. I asked further about her diagnosis of these and she said she's just seen regular family practice doctors and even a neurologist. I asked her to describe the headaches in detail. How long they are, where on the head, what time of day, etc. She got irritated with me and said, aren't we supposed to be doing a simple eye exam? These headaches don't have anything to do with my eyes. They are migraines. At that point I stopped asking questions and silently hid my anger with her and just did the eye exam. Near the end of the exam I noticed her optic nerves were swollen. I explained that swollen optic nerves require urgent referral for imaging of the brain. CT, MRI need to be done first and other testing if there is nothing found. They came back clean. I ordered a lumbar puncture after that and her cerebrospinal fluid pressure came back 3x higher than normal. She was put on a medicine to bring it back to normal and her unquestionable diagnosis of migraines that she had every day for 20 years were instantly cured. Sadly, it's possible she was told that by her doctor. I have migraines and my doctor couldn't give less of a crap. Well, they run in your family. It's just genetic. I don't know what I'd have to say to get her to investigate further if I were desperate. A lot of doctors just dismiss them out of hand. I've not had any embarrassment answers in psychiatry, but I did have a patient's dad who was adamant that his son wasn't psychotic. He was just lazy and didn't want to work. I mean, he thought he carried a demonic parasite that drained his soul, but yet. A relative of mine caused 2 other random patients to panic when she told them she had breast cancer. They thought it was highly contagious and were outraged about her being around kids. A patient with HIV verging on AIDS who did not want to take medications for it. Instead he insisted that an alkaline diet and antioxidants would cure him because germs can't live in the presence of oxygen. What antioxidants and alkalinity have to do with increasing the oxygen in his body I don't understand. Teenage male patient came into the clinic with his girlfriend because he was growing breasts with milk production. Turns out his girlfriend was giving him her female hormonal birth control pills for extra protection. Once had a patient ask for a fecal matter transplant. Legit medical procedure, but they wanted cow fecal matter used. No, just no. They wanted cow fecal matter used. Bulls. I've gotten in debates with patients who have festering foot ulcers about the relative benefit of their dogs licking the wounds to keep them clean. I work in physical therapy and often get expert patients who don't want to trust my judgment as a clinician. They are so certain their doctor gave them instructions that are far from what is clinically safe or recommended. Then when presented with a kind but stern response, they want to make it seem like I haven't been licensed for many years and or maybe an expert in the area. At this point in my career I've seen hundreds of hip and knee replacements and even have spoken to most of the big name orthopedic surgeons in my area. I know what I'm doing and I know what these surgeons expect of me during my physical therapy. If we don't get the right outcomes they will not send patients to us. It's important that we know what we are doing to ensure job security. Had one last week that was giving my co-worker a hard time over their weight bearing status, so I stepped in and told them that we have to follow the most recent doctor's orders regardless of any verbal orders a patient receives. If the doctor didn't transcribe an order, it's for all intents and purposes not valid. This patient was so sure of themselves, so I called the orthopedist on speaker to confirm the order. The orthopedist was very peeved that they were lying to us and scolded the patient. Apparently they had been pressuring the doctor for increased weight bearing to progress their walking, but the doctor had wanted to play it conservative and limit weight bearing for a few more days, weeks. It was pretty gratifying to watch their reaction and see them scolded for lying. TLDR. Patients can be pains in the asses and not trust your judgment and treatment. Patient was lying and was put on the spot during conference call with doctor, then scolded by doctor for lying. Not a doctor. I'm a doctor of pharmacy and sometimes it can confuse people that may think I'm a medical doctor. Anyway, this story happened a few weeks ago. Had OB nurse call me to talk to her family about vitamin K shots. These are given to newborns to prevent hemorrhages and excess bleeding. Now there is some controversy regarding the practice of giving Vitcand is kinda similar to the anti-vax movement. That's not why the parents were concerned. They read online the shot contained benzyl alcohol. Benzyl alcohol is not uncommon to have in some injections because it inhibits microbial growth to keep it sterile. It is very dangerous for newborns and is never in injections meant for them. The parents didn't know that part. They were upset because they thought that the alcohol is equivalent to giving the baby a full beer and will make it drunk. The parents were in their 40s. I have many more, but this is just one that is more recent. This one woman didn't understand why it was so hard to get rid of her cancer. She said, "Why can't you just find the one big cancer cell in my body and leave all the other ones?" If I could legally share pictures. Late to the party, but had a 63-year-old Asian woman come in with a lump on her breast. She said it had been there for 6 months, but she was treating it with Chinese medicine. She had me 2 weeks before the visit and that's why it's getting worse. I asked her to put on a gown thinking I am going to have to examine the breast to find the lump. The lump found me. 7x9 centimeters, black, red, inward nipple and raging eczema like Paget's of the breast. Sent her to breast clinic urgently. My father was an oncologist, and one of his patients was a semi-known religious leader in our country. More of a cult than a religion. TBH. After a round of chemo, said patient threw up, and one of the members of their congregation told them that God had intervened and they had thrown up the cancer. My father tried explaining why this was nonsense, but they nevertheless stopped treatment and told their congregation that God had intervened and destroyed the cancer. Needless to say, they died soon after stopping treatment. I had a morbidly obese patient referred to me for back pain. His MRI showed mostly degenerative changes, and nothing yet surgical. I told him needed to lose weight. My regular doc told me the same thing. Really got on me for my drinking. 2. Said I can't be going out every night after work with my friends for beer, cause it was gonna kill my liver and keep me fat. Oh, so did you follow his advice? I asked. Yup, stopped drinking beer altogether. Now I bring me a 6-pack of that Ensure stuff when we go out. My buddies give me a hard time about it, but I told them I have to do it so I can lose some weight. Yeah. A 6-pack of Ensure every night is much better for your weight than a few cans of Bud Light Fasipam. OMG. So many to choose from. The common ones are anti-vax nutters, especially those who want antibiotics for their spawn's obvious viral illness. Had a parent once tell me I should RX an antibiotic because their kid was unvaccinated. No. People who regularly use alcohol, tobacco, and drugs, not wanting to be a pill taker or put unnatural things in their bodies. Opioid addicts who come up with every reason in the book why any pain medicine that is not an opioid is too dangerous to take. This is like saying you're going to swim across shark-infested waters because a well-constructed bridge to walk over them may collapse. However, possibly my most favorite one was this douche who came in because he thought he had appendicitis. Turns out he was actually right in that he did, and it had a microperforation and abscess already on CT because he'd sat on it a couple days. So Mr. Douche had googled it and decided that since in some places they treat appendicitis with antibiotics, he was going to do so for his appendicitis. I explained very patiently for way too fricking long that the research into that only applies to simple early non-abscessed appendicitis and was not appropriately applied to his situation. And I am bitter that I will never get that half hour of my life back. His main reason for wanting to avoid surgery? He didn't want scars on his six-pack. If you haven't already gotten the picture here, think of the situation from the Jersey Shore. I refused to participate in his stupidity and prescribe antibiotics, so he left against medical advice. Fast forward 2 days. He had purchased fish antibiotics and was taking that to treat his abscessed appendicitis. He now is septic with a fever of 103, a lactate of 6, and systolic BP in the 80s, which is hella sick. Fortunately for him, he was young healthy, and it's actually really hard to kill young healthy people. I'm not saying it's impossible, but you have to work really hard. So Mr. Douche pulls through but ends up with a full laparotomy, zipped right down the middle of his six-pack, instead of the nice little laparoscopy scars he'd have had if he'd come in the first day. It happened almost a year ago. I just finished my MBBS and I was interning at the same hospital I graduated from. As a part of our internship program, I was posted in a small clinic that deals with minor medical issues which don't require any major investigations. So one evening this guy walks in with a complaint of neck pain from morning of that day. After asking a few questions, it was clear that he slept in a weird position which was the cause of the pain. I tried to explain to him that the pain is temporary and there really is no need for him to take any medication. It was a govt clinic and we were running short of supplies. But the guy was adamant on getting a medication. So I prescribed a painkiller. And since this particular painkiller was known to cause gastritis, I also prescribed a drug called ranitidine, sold as a popular brand name called Rantac in India, as well. This guy knew that Rantac was something that doctors prescribed for stomach pain, and he had no idea what the other drug does. But once he saw that I have prescribed Rantac, he threw the prescription literally on the floor and started to complain to the nurse that we, my friend and I, didn't know anything and that we have prescribed a medicine for stomach pain when his complaint was neck pain. I turned to the nurse and just explained to her why I did what I did, and once he heard that, he silently took his prescription and walked away from there. 911 dispatch call that was transferred to M service. I need an ambulance. Okay, what's the problem? I think I have the flesh-eating bacteria. What makes you say that? Do you have any sores or anything? I went to sleep and woke up with holes in my underwear that weren't there last night. I'm honestly not sure how the EMT operator kept it together on that one. Not a doctor, but was discharging a patient and going through his instructions. I advised him to take his antibiotic with food. He asked, should I roll it up in a piece of bread? I told him he could try eating a sandwich instead. Not a doctor, but work in pharmacy. An old guy who had got an inhaler prescribed by his GP because he was allergic to his new dog. He came back to the pharmacy and said he was still completely breathless around the dog despite using the inhaler 4 times a day. On further question, it transpired that 4 times a day he was spraying the dog's coat with the Ventolin inhaler. Another gentleman who complained that he was in excruciating pain when inserting his suppositories and physically couldn't get them into his butt. It turned out he wasn't taking them out of the wrapper, which is normally made from really tough foil or plastic. Ouch. How did we ever survive as a species? When a woman in an emergency room told me she wasn't going into labor because her app said she wasn't ready yet, I could see the top of her daughter's head. But what the frick do I know? Keep asking Apple for advice. So I'm not a doctor, but a girl I went to high school with is in her 2nd year of med school and still posts anti-vax stuff for all to see. I know someone starting med school soon who believes mental illness is not real and people just need to suck it up. ED. I kept having diarrhea. Told my butt to stop it or I'd stop it my dang self. Now nothing is coming out. It worked. But my stomach hurts a ton now the past week. Got a plain film. Screwdriver in rectum. Handle first. He went to surgery. Once had a patient who took her baby to a chiropractor her friend had told her about. Her baby has a growth defect due to deficiency of growth hormone. She said her chiropractor would adjust it so baby will be happy again. It's comments like these that have made me come to a growing realization that hospitals and clinics might need to have CPS representatives in the building with the ability to suspend people's right to a child if they are putting them at serious medical risk. 60-some YO pancreatic cancer patient wanted to be treated with herbs and natural medicine instead of having the Whipple surgery she needed that could save her life. She let it progress while continuing to have it treated by her natural medicine doc. Finally came around after a few months. She's lucky she survived and went to the operating room, but immediately after surgery and through discharge from the hospital was trying to stay off the bowel regimen and other medications usually given after this type of surgery. Diabetic patient strictly adhered to her diabetic diet by drinking 12 cans of Mountain Dew the past week instead of the usual 24. Midwives gynecologists of Reddit. What's the weirdest thing you heard from a pregnant woman or her family that made you think they had no prior sexual medical education? I had a girl call the office because she swallowed a cherry seed and was worried that the baby was going to choke on it. For some reason I'm thinking of Luann from King of the Hill. I've told this story before, but it bears repeating. I worked as a telephone triage nurse and received a call from a very concerned young lady. She said that she was pregnant and had gone to an appointment with her OB-GYN that day and had some questions. This was relatively common. Patients can sometimes feel rushed in the doctor's office or forget the questions they were going to ask, so they call and ask us later. Me. Okay, no problem. How can I help? Pregnant lady. Well, the doctor told me I can't have any more sex until after the baby is born. Me. Looking at a record in the computer. Okay, I see you're pretty far along and were having some preterm contractions, which can be caused by sex. So the doctor recommends no sex so that the baby doesn't come too early. Pregnant lady. But how will I feed the baby? Me. What? Turns out, her male partner convinced her that babies needed to eat semen to develop, and this could only be done with PIV sex. I told her this was totally wrong and gave her a quick lesson about the umbilical cord. She was skeptical until I pointed out that single women and lesbians have perfectly healthy babies without constant sex. Oh, okay, that makes sense, she said. Then she thanked me and started to hang up the phone. I could hear her calling her partner's name as she hung up. Would have loved to have been a fly on the wall for that conversation. Oh my god. I'm a midwife. I was booking a woman at the beginning of her pregnancy and she wasn't exactly pleased about being pregnant. I asked her if she was sure she wanted to continue the pregnancy. There's no point me booking her if she wants a termination. She starts ranting about how it was the soft drinks industry's fault and how she's going to sue them. I was pretty confused at this point and asked her what she meant. She informed me that she had been washing her vagina out with cola following sex and that she must have bought a bad batch as she was now pregnant. I went to see a woman who had delivered her first baby a few days previously. I knew she had had stitches but she seemed to be in a lot of pain. I asked her if she wanted me to check them and she consented. And when I did, I got a strong whiff of chemicals. I asked her what she was using to clean her vaginal area with. We advise women to just use water for the first few days. She told me she was using Dettol, a household disinfectant here in the UK, as she always used it in her kitchen and she'd never got ill from her food, so it must work in preventing infections. A few words with me and when I saw her the next time she was moving around freely like she was in a Tampax commercial. This one isn't really to do with sexual education but was really a WTF moment. We have bags that are given away to new parents and they have free samples in baby wash, fabric conditioner, nappy cream, etc. I examined a baby who was 10 days old and her skin was almost red raw in places. I thought it was the worst case of eczema that I had ever seen and that she should get the baby checked out at the hospital. While I was trying to get through to them, I asked her if she had been bathing the baby in anything. Again, we advise using water only for the first couple of weeks. English wasn't her first language but her husband came home at that point and translated for me. They had received a free sample of fabric conditioner in the pack. This had a picture of a smiling baby in the front. They assumed this was baby soap, had bought a massive bottle of it, and had then bathed the baby in it. Neat. Luckily the baby had no lasting effects. Attention. Humans with vaginas. Douching is bad. Douching with cola is very bad. I work in public health and family practice. We get our own special ones. Most recently the lady with chlamydia that stated she did not use birth control because you cannot get pregnant if you have an STD. Right. Yes, she knew she had the STD and yes, she was sexually active. Well, she isn't completely wrong. Some STD do in fact cause fertility problems. However, I would not rely on that as a method of birth control. Not a midwife but do medical triage over the phone. Had a 19-year ring because of abdominal pain. Asked further into the assessment as she was pregnant. She is. Call changes tone. How far along? 37 weeks. Could you be in labor? She doesn't think so. I just need to put the phone on my bed while I get changed. Why are you getting changed? But embarrassing. I think I wet myself. Do you think that could be your waters? She sounds skeptical but grudgingly agrees it could be. I ask if she can get to the hospital. No, everyone in the house is drunk. I ask if I can send an ambulance. She doesn't want me to as she has a house full of people watching the match. This is during the football world. My mom did this with me. First kid. Apparently her water was just a trickle and she changed underwear like 4 times. My dad just laughed at her, gently, while trying to convince her to go to the hospital. We had a woman come to triage one day, in no visible distress, but certain that she was in labor. She denied feeling any loss of fluid, contractions, or pain. When questioned further, she explained that she was already dilated for. She was accompanied by her granny, who explained that she had checked her granddaughter at home and she was able to fit 4 fingers inside the vagina, so she knew it was time. Not in the cervix, in the vagina. No, granny knew. Obligatory. Not a doctor or midwife but my friend with multiple kids had a yet another pregnancy scare months ago. She said she thought she'd be protected since she had taken the morning after pill a month before. She also told me some time ago that she wouldn't bother with the pill anymore because aside from side effects, which I understand, they can be awful, it didn't work and she still got pregnant on it. I asked her if she took it every day and she said well I'd miss a few days here and there but it still should have worked. Oh geesh. No girl. No. I had a cousin that had a friend that told her a way to save money was to stop taking her birth control for 6 months. Friend told her that birth control pills were still effective for 6 months after taking them. As you can guess, she ended up pregnant. It was the only reason we found out about her genius money saving plan. Not a MW or Gino but a story from a doctor in a town where I used to live. A man and wife had a daughter. Then he somehow, farming accident, lost her testicle. Then the couple had a son a year later so all his parts work, right? Then a few years later they have another daughter. All heck breaks loose in the maternity waiting room between the two families. His family is insisting that the mother was fooling around because he lost his girl testicle in the accident. The doc had to separate them. Then had to give a lesson about reproduction right there to explain that men's testicles aren't made to be one to make boys and the other to make girls. Members of both families were apparently confused about it, he said. I wonder how many men throughout history would have cut off their girl testicles if it actually worked that way. It goes like this. Me. Your pregnancy test came back positive. PT. Oh, I couldn't be. Me. Are you sexually active? PT. Yes. Me. Are you using any birth control? PT. No. Me. Then why don't you think you could be pregnant? PT. Because I couldn't be. Me. Repeat seen many times over past 20 years. Denial is not a river in Egypt. A shocking number of women think they cannot get pregnant if they are breastfeeding or just haven't had a period yet after giving birth. A lot of teens think if their period is irregular, they are somehow unable to conceive. You do not have to be menstruating regularly to get pregnant, folks. A lack of a period is not some natural birth control. Also, I see a lot of women who for some reason think they can't conceive after the age of 30 and are shocked when they get pregnant at 35 or 40 or even later. I'm a guy. I've had women tell me I don't need a condom and then after a few basic questions it becomes clear that they just kinda feel like they can't get pregnant or just won't right now. Okay, I'm not going to debate a woman about women's biology and fertility, but I'm sure putting a condom on, as I have the right to choose to be a father, the one without a uterus, I believed. Dad was a high-risk OB-GYN. once had to argue with a woman that her daughter emphatically did not get pregnant from swallowing, despite her protests that her daughter was a virgin, to which my dad replied he was only aware of one previous virgin birth in history. When my great-grandmother went into labor with her first child at 18, she asked how the baby was going to come out, and the midwife said the same way it went in love. Midwife saying, in like a banana, out like a pineapple. Neither, but my high school principal used to work in juvie and told me about a pregnant 14-year-old who insisted she was carrying Jesus reborn. Turns out her father was a pastor and had her convinced he couldn't get her pregnant because he was her dad. Honestly, I never got the talk but had unsupervised access to the internet since I was like 12. That's really sad and horrifying. Very young girl, barely 13, came in for symptoms of a UTI. Pregnancy test came back positive. Her and her mother claimed that could not be possible because you can't get pregnant until you're 18 inches. When asked why they thought that, mom said, well, if that wasn't the case, why would they put warnings for pregnant people on cigarette packs? And the daughter genuinely thought that only grown-ups can have babies. Not an MW or Geno, but one time I made out with a girl and the next day she was crying because she thought she was pregnant. We were 22. When my uncle's ex became pregnant with my cousin, I thought I was the father because I hugged her one day when she was babysitting me. I was 9 when that happened. My mother is a midwife and this one story sticks out. A couple is in her office looking very somber and the woman has been crying. Mom, what brings you in today? Man, this points to a spot on woman's lip. Mom, looks like a cold sore. Man, what are we going to do about this? Mom, have you tried a breather? Man, that is for herpes. Mom, yes, this is a form of herpes. Man, I knew it. Check her for gonorrhea and chlamydia please. Mum to woman, ignoring man, have you ever had a cold sore before? Woman, yes, in 2012. Mum then had to go in circles for 20 minutes with the man about how it's not sexually transmitted necessarily, how it's very common. She didn't cheat on him since she had it for years, and that he probably had it. He cursed my mom out for accusing him of having an STD after she said that last bit and stormed out. My mom had to have a come to Jesus talk with the woman about leaving this loser. Crazy how little people know and how angry people get about how ignorant they really are. When I was a medical student on my OB rotation, I saw a young girl who was pregnant but swore that it was impossible. I asked if she was on any birth control and she said that she didn't need it. She said that her BF was kicked in the balls a lot. I lost it at a lot. Not a midwife, but I had an acquaintance try saying that she was only pregnant for 6 months but that her baby came out full term. Like her child was fine and needed zero medical attention due to being so premature. I don't think she was actively lying, but she was not a bright person. She might have found out she was pregnant at 3 months and just assumed that she was just newly pregnant by the time she found out. Or maybe she felt bad for drinking partying early in the pregnancy, so she refused to acknowledge it until it was convenient. Either way, it sounded very fishy. Not a midwife, but did have an acquaintance who got pregnant while her husband was in the army deployed. She had convinced her husband that they needed to try and get pregnant. So how do they resolve the issue of long distance and time? They concocted the plan of using a turkey baster, where the husband actually mailed a package of his little soldiers to her and she used the baster on herself to impregnate herself. No doctors were consulted during this time. And this story all came to light in divorce court when someone actually convinced the husband the baby was not his. My dad worked as a hospital orderly to put himself through college. He told me that he went to clean up half of a double room. The other half was occupied. Sitting in the bed was a girl who was somewhere between 14-16 going through labor. She was in agony on the bed, her mother holding her hand, and a teenage boy who was most obviously the father was crying in the fetal position in the corner. Eventually, the girl's father came into the room, seemingly having just heard that his daughter was pregnant. She was very small and it must not have shown well. The father threw the teenage boy against the wall and screamed at him. "How the frick did this happen?" he screamed. Through tears, the kid said, "My brother told me it wouldn't happen if we were standing up." Midwife here. I had a couple booking with me and I'd delivered their first child. Her booking bloods showed chlamydia. The husband nonchalantly said they were being treated and she probably caught it from her previous birth. Slight mail order bride situation. Yes, I used my chlamydia gloves to catch their other child. Another woman who was pregnant with number 9 in 9 years was on the antenatal ward. I was discussing contraception with her as she'd never had time to before, and we'd recently started placing iodes immediately after birth. English was her second language and she was amazed she wouldn't have to have another baby in a year. Her face was a picture when I showed her the vasectomy handout. Oof. I feel for the mother of 9. Sad how some cultures and places have such minimal sex ed that folks end up in such a position. My dad was a GP. He retired about 10 years ago. He had a couple, lovely people, very young, a bit unworldly, come to see him to discuss their failure to conceive, about 30 years ago, when I was 10 or so. He was bright enough to ask what they were doing in bed. They had both somehow come to the conclusion that what was needed to make a baby was penis belly button contact. I have no idea how anybody was getting any satisfaction, or how on earth they kept believing this after doing it once. It must have been a horrible experience. He explained, literally, the facts of life to them, and on coming home had the talk with me and my brother, just in case we were all so stupid. The couple in question ended up with 2 kids. Good old dad. While deployed, we had an Afghani man come in with his wife for a fertility check. He made it very clear they'd been married for over a year and she hadn't conceived, and if she was incapable of conception, he was going to divorce her, dishonor her, send her back to her parents, ruin her life. Apparently, it never occurred to him the fault could be with him, not his wife. First idiocy. The doctor was willing and had the time to sit and talk with him. She wasn't allowed to speak. After an hour of questioning and careful probing through an interpreter, it was discovered this man had no idea what the vagina was for. He'd been forcing anal sex on her since day one. Second stupidity. She was still a virgin. The Canadian doctor had to explain to him about penis-vaginal sex. Even draw him a diagram to show him the proper way to have sex. About a year later, he came back to thank the doctor, who was gone. She gave birth to a healthy baby boy. If she'd had a daughter, I doubt he would have come back because, you know, the sex of a baby is all up to the mother and the father has nothing to do with it and the woman chooses the sex. Huge eye roll. Also, girl children are useless. That's the worst I've ever seen as a medical professional. A woman's life was literally on the line and a man's uneducated stupidity was the deciding factor in the entire equation. Jesus, the fact that that last sentence in your story is so applicable now just as it was then, just as it was a century ago. Freaking chills, man. A friend of mine works labor and delivery and told me this story. A 13-year-old pregnant teen comes in. Days like this for the staff are hard, and they're trying to be as sensitive as possible. As they're getting her ready for delivery, she starts to panic, saying that the hole isn't big enough for the baby to come out. She thought the baby was supposed to come out of the belly button. Similar but related incident. I worked as a photographer for a crappy newborn photography scam service that the hospital provided. I go into a room one day and notice a young woman, maybe late teens early 20s. Right away I notice she seems to have a sort of tick-in ability to recognize social cues. Whatever, no worries. I start making small talk about her newborn. I say something along the lines of, "Oh, you had the baby on the 1st of this month. What excellent planning on your part, haha, you know, because you can't expect when the baby comes." This woman stares a little blankly at me and says she didn't know she was pregnant until she started contracting 2 days prior. I talked with my friend later, and she says that they would get a lot of mentally intellectually disabled women come in pregnant or in disbelief that they were pregnant because they didn't know or understand what sex was, or because they had been raped and didn't realize it. I don't know how we monitor it, but intellectually disabled people need to have access to sex and consent education too. Also, sorry op, I know these probably weren't the funny stories you were looking for. Not a midwife or gyno but patient here. I asked if my twin boys could see each other in utero. The nurse laughed and said it was pretty dark. I was 35 and it was not my proudest moment. I don't know what I was thinking. Pregnancy brain. It's real. Mother is an OB. She always says that the amount of people who don't understand that you need to take the birth control pill daily is unbelievable. She hates abstinence-only education. It leaves her with patients in their 30s who don't understand how STDs are spread, how you actually get pregnant, or that sex can be enjoyable for women. Abstinence-only education is the absolute worst. I once had a classmate tell me she made her boyfriend wear 2 condoms during sex, for added protection. I do ultrasound. When I was a student, I did a rotation at a small OB-GYN clinic. One day, a woman and her husband came in for a pelvic ultrasound. They had come to see the doctor because they were having trouble conceiving. They said they had been having sex regularly for almost a year and had not gotten pregnant. My instructor asked the patient if she was on medications. Standard question. Only my birth control pills. In a year of trying to get pregnant, neither she nor the husband had thought maybe she should stop taking her birth control. You should rename the birth control pills into the German name, anti-baby pill. Maybe that helps. Not a midwife, but I knew a lady who refused to drink coffee, not because lots of caffeine is bad during pregnancy but because she believed that coffee would turn her baby black. Of course, coffee makes them black, chocolate brown and tea yellow. Not a midwife doctor, nor did this story end with an actual pregnancy, but the fear was there in the boyfriend. I was talking to a guy I knew and he was super somber. He told me that his girlfriend was pregnant. He had led me astray before, so I asked for details. Did she take a test, see a doctor, etc. He said that her period stopped, therefore she was pregnant. I had to explain to a 25-year-old guy that women didn't bleed 24/7 and that your period ending for the month wasn't a symptom of pregnancy. Imagine going through life thinking all the women in the world are bleeding right now. Not any of these, but I did work with a girl that thought she couldn't get pregnant if she was on top. Found this out after she got pregnant. My high school Spanish teacher ran a sexual education program in the Peace Corps for women in a South American country. Most of these women were already married and had many children, but couldn't afford to keep procreating because they could barely afford to feed the children they had. My teacher and a few other women went over how to use condoms. They explained all of the steps for putting it on, using a banana as a stand-in penis, and then distributed free condoms to each of the women. In the next few weeks, they noticed some gaps in their explanations. For example, my teacher was riding her bike home one day and noticed one of the local women hanging condoms up on the clothesline to dry. The woman had been washing them and reusing them. However, the biggest misunderstanding came 2 months later when another woman came to see my teacher. She was screaming and very hard to understand, but my teacher gathered that the woman was pregnant. My teacher explained that it's not a foolproof method. Condoms can break, etc., and asked the woman to walk her through how the condom had been used so they could better expand on the issue. The woman replied by saying she had done everything they instructed. Before having sex, she would roll the condom on a banana and put it next to the bed. TLDR. Peace Corps instructor demonstrated condom usage on a banana. One woman became pregnant after putting a condom on a banana when she and husband had sex. A heavily pregnant woman put her finger in her belly button and pulled out something gross. She immediately freaked out, making her husband freak out as well. She called my friend, who is a doctor specializing in OB-GYN, and almost cried on the phone. Prego, help. I just pulled something out of my belly button. My friend, MD, yeah, prego. So, have I removed a plug or something? Have I hurt the baby? My friend, MD, but you just pulled something gross from your own belly button, right? Prego, yeah, but isn't my belly button connected to the baby's belly button? Isn't that how she gets all of her nutrients and stuff? And then they had a long talk about the uterus, placenta and where our belly buttons originate from. Mind you, this isn't about the prego not being educated. She is a lawyer, but she caught pronouncer brain and had a laugh about it afterwards. Not a medical person, but I have a friend who called me one day and told me she was pregnant. I knew she wasn't seeing anyone and was pretty sure she was the type of person who wouldn't have sex outside of a serious relationship. So this was shocking to me. I asked her who it was and she said she wasn't sure, which also confused me. I asked her to explain what she meant. It turns out she didn't get her period when she expected it, so she figured any must be pregnant. She was in her late 30s and definitely not pregnant. Son of an OB-GYN here. Story 1. Patient. I can't be pregnant. OB dad. Why not? Patient. We haven't had sex. OB dad. Have you been naked together? Patient. Yes. OB dad. Has his semen ever made contact with your vagina? Patient. Yes. OB dad. Bad news. Those little guys are swimmers. To this day I still wonder if the dude has to pay child support or not. Like, my American people, Your Honor, I did not have sex with that woman. Story 2. Fat woman didn't know she was pregnant until giving birth. OB dad said family was very excited for her in spite of being surprised. Story 3. Fat woman claimed she was pregnant. Claimed she was in labor. OB dad had to explain to her and family there was no baby. Family freaked because they'd all been buying her stuff. She started yelling that he'd taken her baby. The ruse was unreal. I heard she ended up in the news later trying to kidnap a child, claiming it was from the pregnancy that didn't happen. Not a medical professional, but one of my friends in college told me that it took her mom having at least 2 or 3 children before she went to the doctors to ask why she kept getting pregnant. I think she ended up having 5 kids in total. Turns out there is such a lack in reproductive education in South Asia that the poor woman who was married off in her late teenage years literally had no idea how exactly pregnancies came about. Despite having moved to Europe, my grandmother asked her OB when she was pregnant with my mom how it happened. This would have been 1953. My grandmother was 20. She had no idea that sex caused pregnancy. And my grandfather didn't know she didn't know. This was the US. I am ashamed I was the person. I am a 41-year-old, married female with no kids. By choice. I had to have a nurse on Reddit tell me that indeed you can get pregnant by sperm just being in your passage, meaning on the very front of passage. Minimal penetration. Either the penis had to go deep and maybe even penetrate the cervix. Yup, lucky I have an implant. I was an unplanned pregnancy. One guess how I was accidentally conceived. The cervix isn't really something that is penetrated by a penis. I'm no expert, but as the owner of a cervix who has also had a child, if my husband so much as joked about trying to get up in my cervix, I'd probably lock up the coochie right then and there. Having doctors basically finger my cervix to see how dilated I was is one of my top 10 most painful things I've experienced. Medical professionals of Reddit, what is the craziest DIY treatment you've seen a patient attempt? Anesthesiologist here. We had a patient come in for IND of bilateral deltoid abscesses. He apparently had thoughts of being a bodybuilder, but instead of lifting weights or knowing someone who could hook him up with some quality steroids, he decided to bulk up by using some protein powder at GNC and mixing it with water, drawing it up into a syringe, and injecting 20-40 cc daily directly into the muscle. If bulk was what he was going for, it definitely worked, temporarily. A rip-roaring localized infection makes you look plenty swole. They got almost a liter of pus mixed with liquefied protein powder out of each deltoid. This also wasn't the first time he'd been in for this problem. My dad had an abscess on his face. It was huge, about the size of a golf ball and horribly red. It kept getting bigger. My mom, a nurse, kept telling him to go to the doctor, but my dad was a ridiculous cheap butt. One day when she was gone, we noticed that a big white head had formed on the abscess, and it was apparently ready to bust. My dad went out to the garage, got his shop vac, placed it over the white head, and proceeded to suck out the abscess. It worked surprisingly well and healed up after that nicely. Mum was still furious, though. Paramedic here. Once had to explain to a family that putting lemon juice in the eyes of an unconscious patient isn't an approved treatment method. And no, it didn't work. It was an interesting moment when I had to explain why his eyes hurt. Smelling salts equals seeing acids. If I've learned anything from reading the comments here, it's that some men will tolerate almost any amount of pain to avoid a doctor seeing whatever stupid crap they've done to themselves. This is no exception. I once spoke to a paramedic who went out to a man at 2 AM who had excruciating pain down below. The poor organ was wrapped tightly in soaking bandages, and underneath was a blackened penis with large pus-filled holes in it. The man eventually admitted that he shoved a chicken bone, a clean one, whatever that means, down his dong for pleasure. Predictably enough, he couldn't get it out, and being too embarrassed to go to the doctor, he left it until he was in so much pain he couldn't walk, both from the rotted penis and the fact he hadn't been able to urinate for days. Apparently you could actually see the bone once the wound was clean, and although not an expert, my friend couldn't imagine that what was left was salvageable. I had a guy come in for coughing and shortness of breath for the past few months. His lungs sounded like absolute crap. Got a chest x-ray that looked horrible, so I did a CT scan. Radiologist called it the worst case of necrotizing pneumonia he'd ever seen. Dude had like a 15% functional lung tissue left. The patient then mentioned things had been worse after he started using a new breath freshener spray. He whipped out one of those blunt effects concentrated air freshener bottles, supposed to cover up weed smell, labeled not for internal use. Apparently he had been using it like Binica spray, and had already gone through 3 bottles. In nursing school, while I was on clinical rotation in urology, there was a man who ended up having his penis removed. It turned out he had an infection brewing for quite a while and thought the best course of action was placing a sock over his penis in hope that it would heal. He was generally confused and upset as to why this didn't work to heal the issue. The classic, if I can't see it then it's not a problem. One of my first clinic patients was a dude who was injecting a mixture of testosterone, human growth hormone, sesame oil, and sunflower oil into the base of his penis as a DIY penile enlargement therapy. Well, it got infected, so he ended up going to the ED for incision and drainage. I saw him as a post-ED visit, and at that time, he figured that he shouldn't be injecting into his penis while it was healing. So instead, he was injecting his oil and sketchy hormones off the internet concoction everywhere else into his body, arms, legs, butt, shoulders, etc. because he figured it would still have some effect. Till, some men are capable of committing atrocious, heinous acts of terror on their own dongs. There's a myth that lowering someone's core temperature will save them from an opiate overdose. As a result, many first responders have arrived on scenes to find friends, fellow users inserting ice into someone's rectum. Sometimes they don't have ice around though, which leads to getting inventive. Popsicles, frozen hot dogs, my personal favorite, which regrettably I didn't witness myself, it was told to me by another medic, was a bag of frozen French fries. Cold will do nothing to help someone who is overdosing on H or other opiates. What they need is respiratory support, oxygen and or artificial ventilation, and naloxone, Narcan. If you're a user or know one, and somebody ODs, call 911. Perform mouth to mouth and give Narcan if you have it, but leave the popsicles in the freezer. I work in dental and years ago had a patient attempt to superglue her front tooth back on after it broke in half. She screwed up and ended up gluing the chunk to her upper lip. I had a dental patient with a dead front tooth that had turned black, so she painted it with white nail polish daily. This happened when I was still a med student doing a rotation in the ED. Patient comes in and is pretty vague about his actual complaint. Something about head pain, but he looks just fine sitting waiting to be seen. When I finally get to see him and ask him what actually happened, he removes the hat he was wearing and a chunk of skin about the size of my hand literally flaps off of his skull. This guy managed to basically scalp himself, and apparently it had been like that for 3 days. According to him, it was caused by falling in his bathroom and hitting his head on the toilet. He had been previously duct taping it down or using the hat to hold the skin on, but it wasn't sticking well, and that's when his wife convinced him to come to the hospital. I like my skin on my body more than I dislike hospitals. Pharmacist here. Worked in a shop where a woman asked for some advice about potential UTI or STI. Told me she had bathed her vagina in bleach for 5 minutes to try and kill any bacteria. Miraculously, she hadn't done any lasting damage. A 50-year-old man swallowed a chicken bone while eating, and it got stuck down his throat, upper esophagus. Unable to take it out with his fingers or coughing, he got a fisher hook with a line and tried to rescue the bone with it. He ended in an emergency department with both the bone and the hook in his esophagus. An old lady told me the rain hurt her arthritis. That's reasonable. She also swore that dogs spit had healing properties, so she let her dogs lick her feet when she felt it coming on. She then wanted to show me a video of said dogs licking said feet. I swiftly and politely declined. Adult patient had gas and poked a hole in his belly button with basically a knitting needle to release it. I didn't think it was possible to ever cringe this hard. You've proved me wrong. I work in oncology pharmacy. I had a patient die of totally treatable breast cancer because they decided to treat it with mistletoe instead of chemo. All because Suzanne Summers did. Yeah, the Thighmaster lady. Don't take medical advice from the Thighmaster lady. A little late to this thread but have a weird one. A patient was told by her doc that she had low magnesium and should consider supplements. It's not uncommon. Instead of getting MG supplements, she ate an entire tub of homeopathic volcanic ash and completely destroyed her electrolyte imbalance and ended up in ICU. We admitted her as a pharmaceutical overdose, so poison control automatically follows up with you. It was hard to explain to them. Ate an entire tub of homeopathic volcanic ash. Dang, that's some advanced stupid right there. A mentally delayed woman came in septic to the ED. Did Thrays, blood cultures, urine cultures, the works. Finally found this weird image on her pelvis film, and we had Jin come do a pelvic exam. They pulled out this blob with bones in it. Y'all, I swear to God, it was a decomposing frog. She put it in her vagina for safekeeping. She got toxic shock syndrome from a frog. Not me, but my boss, mother of the child I care for, is a nurse practitioner. I asked her what the worst thing she had witnessed was. She continued on to tell me the story of a man who had stapled his ball sack together and onto his body after slipping with the razor. He had it that way for days, metal holding his poor testicles in place, infected and gross as you would expect, before he came to a professional. Later admitted his ex attempted to castrate him. The balls lived. Later admitted his ex attempted to castrate him. I guess that's why you don't judge people when they come in with weird injuries. Dude came to the ED because his leg was swollen. I'm talking, like, twice the size of his other leg. It turned out that his 4th and 5th toes were getting caught on his sock, which, to be fair, sounds super annoying. So he cut them the frick off with scissors, and then it got infected, and he waited, and waited, and that's how he lost his entire fricking leg. Having once seen a commercial that oatmeal can lower cholesterol, a patient started having chest pains and tried to resolve it with a bowl of oatmeal. We had a guy come in with an abscess on his right thumb. When I asked him what happened to his hand, he told me about his recent deep sea fishing trip and was given the responsibility of cutting the fish with an open wound in his hand. A sliver of fish got in there and became infected as it healed. So this guy gets the bright idea of doing a little DIY wound drainage by grabbing his pocket knife and cutting it open, leading to a greater infection. Yep, I had a crack addict cut her thumb on her broken crack pipe. The thumb was incredibly infected. She grew tired waiting for the hand surgeon to arrive. He was in the operating room with another patient, so she bit her finger to release the pus. Then she left the hospital, cursing the staff the whole time because we are useless, etc. As a child I got really bad sunburn. The person looking after me coated my sunburn in baby oil to help it heal, and sent me back out into the sun. I realized when I was older why my mum went nuts. I have a Jamie Oliver recipe that directs me to do the same thing midway through roasting a chicken. My mom once melted Vicks Vapor Rub into my tea because she thought that would help my cold. It didn't. I know people who would do this, more than one of them. They'd swear by Vicks Vapor Rub, and kind of treated it like a cure-all. Patient used to get boners in class and it embarrassed him, so he used rubber bands to prevent it. Ended up killing the tissue in his penis and now he needs a catheter for life. A man who'd accidentally sliced his leg open at his workplace. He obviously figured that as surgeons use staples to close wounds, he'd cut out the trip to hospital and DIY with an ordinary desk stapler. Arrived in ED with a pus-filled wound with the odd discolored staple hanging off it some days later. I am not a medical professional, but my father-in-law had severe skin cancer. He basically had an open sore on his back for several years that bled and bled. We never knew about it until one day we saw a pancake-sized crater through his shirt. Went to the hospital finally and they basically said he has cancer throughout his whole body at this point. His response was he thought it was a cut that wouldn't heal and put gauze and neosporin on it. God, that's terrible. I've found that sort of attitude is common among elder people though, where they sort of shrug and get on with it. When my granddad was young he fell and dislocated his shoulder. He decided to just pop it back in himself and forget about it. It's never properly healed and still causes him pain so many years later. White bread soaked in milk placed on an armpit abscess to draw out the infection. Needed an IND and a couple weeks of IV antibiotics by the time he got to us. Either that or the guy who crashed his motorbike, scraped his leg all to heck, and then decided the best course of action was to self-cauterize it on the tailpipe. Whoa, stupid or not, the tailpipe guy had a set of brass ones. When I worked in my colleague had to see a guy with an ear problem. He had something stuck in his ear and had been trying to get it out. This wasn't a new thing. He'd been trying for some time. Turned out, he had completely removed his tympanic membrane, and the bits that were stuck in his ear and that he was trying to pick out with cotton buds and hair clips were his ossicles. Enjoy. I have consistent skin irritation in my ears and try and limit myself to sticking cotton buds in my ears to 4 times a week for relief. Thank you. You've cured me of this vice. And I'm setting myself on fire. Good day. Had a patient come into the ER with a makeshift bandage on his shin. He had fallen on rocks while hiking and left a 3-inch long, 1/2-inch deep gash in his leg. I go to pull the bandage off and as I'm peeling it away I notice the skin is completely black and there's dark chunks of fungus falling out of the wound. It looked necrotic, like it had been left alone for a week. I look at this guy like he's crazy as he tells me the wound is only a few hours old. He's pretty proud as he explains that he created a makeshift poultice by chewing up leaves and moss, mixing it with river mud and stuffing it into his leg. That's what all the black mossy stuff was. Hint, don't do this. My grandpa thought a leg discrepancy was causing my back pain, which was causing spasms. He put several pieces of cardboard in my shoes to try to even out my legs, which were already even. He also thinks black beans cure everything. My dad thought those pesky spasms was a pinched nerve, so he would take me to the chiropractor, his girlfriend, to get my neck cracked when it happened. Seizures, people, they were seizures. Black beans are delicious and make a beautiful blue dye. That's useful enough for me. I'm hoping you get actual medical care now. My stepfather thought he had an boil of some sort on his arm a few years ago, so he did what any middle-aged dad would do, cut the sucker open and poured hydrogen peroxide on it. Turns out it wasn't a boil but a form of skin cancer. Also turns out that hydrogen peroxide doesn't do much to help with melanoma. After a lot of one-sided discourse he went to the doctor to get it checked and treated. He's now cancer-free. I work in the ER at a trauma center. This guy comes in with his little girl and says that she was bit in the face by the family German Shepherd. I immediately take her back assuming that I need to control bleeding. What I encounter is a little girl with a laceration going all the way from over her left eye crossing her nose and mouth. It is not bleeding whatsoever and it seems to have an odd looking substance inside. So I obviously ask the dad what she got inside it. He responds very proudly with, "Ah yes. I packed the wound with tobacco from my cigarettes and super glue." Left double quotation mark. Poor thing. Tobacco certainly has antibacterial properties, but pure tobacco, not a cigarette mix. During 3rd year med school I was on a neonatology rotation. Lots of premature babies or high risk births. We'd get code green paged to us for please come to delivery room as able and code pink paged for please come to delivery room stat. There was a pager that was the standard one that got paged for this, and usually it was whichever of us med students who was on call carrying it. Our job was then to get one of the nurse practitioners and possibly a second nurse and head over with the incubator etc. to take the baby and get her to the NICU. About 6 PM one evening as we're doing handover rounds, that pager goes off with a code pink. Then the NP's personal pager. Then the neonatologist's personal pager. The next 10 minutes are a bit of a scramble and not particularly interesting from the point of view I had, as I was assigned to send pages to additional people and fetch things. But in short, a teenage lady of local Aboriginal descent had come in suffering from very premature labor. I want to say 20 weeks, but could have been 22 or so. She and her ex-boyfriend had recently gotten back together. He had discovered she was pregnant. Believing that the baby was not his, he attempted to abort the baby by inserting a bamboo stick and trying to fish it out. She did not want said abortion, so he attempted while she was asleep. Baby and mother survived. Relationship did not. Later testing showed the baby was indeed his, for those wondering. Dental student here. We had a patient who declined a much needed cleaning, saying he could do it just as well at home with a scalpel. Didn't brush his teeth, but every few weeks he would go at the accumulated plaque and tartar with a scalpel. Same patient also insisted we do a procedure without local anesthetic. He was an amateur boxer and was building up his pain tolerance. He also told us he smoked 20 blunts a day and only drank Coke. We could tell. Doctors overdid it. What is the weirdest thing a patient wouldn't admit? Working in the ER we had some interesting ones, but the simplest and most intriguing one I've had was a man came in complaining about chest and side pains. After a few tests to rule out heart issues, we discovered through an X-ray that the man had 19 fractures throughout his rib cage. When I asked him if he had been doing anything dangerous, he replied with nope, just dancing. Needless to say, I'd recommend not trying to do leaping flops into the worm on repeat on concrete, which is the only way I can fathom this occurring. And no, he didn't explain what kind of dancing. Well, he sure wasn't doing the safety dance. The human capacity to deny the undeniable is amazing. As a radiologist, I've seen an 80-pound ovarian tumor, a hand-sized facial malignancy neglected until it eroded an underlying artery, numerous neglected breast cancers, eroding through the skin. People will refuse to see what they really don't want to see. My mother is an emergency nurse, and a while back a 90-year-old woman came into the department complaining of pain in her leg below the knee. After an examination, my mother suggested an X-ray. X-ray comes back and it turns out the leg had been broken several months prior, snapped clean across both the tibia and fibula, and she had somehow ignored what must have been excruciating pain and continued about her life. And then the bones had healed but not straight. The top of the bones were to the left and about 2 inches below where they were supposed to be, and they had fused to the lower parts at the side like that. In the end, there is nothing that could realistically be done, as to sort the leg out would require a breaking it. Dang, I didn't know human bodies could do that. Training as an EMT, so not a doctor, but in the air. Old guy shuffles in with his girlfriend, both mid-50s. He is holding a members only jacket in front of his crotch and wobbling in. We take him through tridge to the back and get him on the exam table. His scrotum was the size of a large watermelon. It hung below his knees and was easily 18 inches in diameter. Serious hernia issue. Just a big oblong mass of flesh that had overwhelmed the rest of his nethers. I think every physician in the hospital came down to consult on it. I mean everyone. Cardiologists, ENTs, etc. Everyone made an excuse to come take a look. This was clearly an issue he had been avoiding for years. The prescribed treatment, if I remember properly, was to Kevlar reinforce his belly and shove all his intestines back up and in. They were going to transport him to a nearby hospital for the treatment, but because it was across state lines he refused to go. So he slid off the table, pulled his jeans up around his crotch, grabbed his jacket and his girlfriend and shuffled off to the bus stop. It's an image you never forgot. Closest thing I can relate it to is when Hugh Jackman is trying to carry the fishbowl between his legs in The Prestige. Doctor friend told me of a man with a flower stalk stuck up his penis. He was trying to give his GF a birthday surprise. Unfortunately, flower stalks have little angled hairs on them which make them easy to push in but impossible to take out. Saw a guy who had a pretty blunt machete lodge perfectly across the middle of his skull, but the angle was unusual and it was like perfectly along, so that caught my attention. Turned out the guy had, unsuccessfully, tried to murder his wife with the machete and later regretted it, so he hit himself in the head with it. He held it with his hand, sharp side front, and gave himself a whack perfectly in the middle of his skull. Thankfully the machete barely made it into the skull, and since it was along the middle it didn't touch any brain tissue. Work in a burn center. For 3 months in a row we had 3 different people come in because they tried to commit suicide by setting themselves on fire with gasoline. I cannot imagine what brings someone to that point to think that's a good way to go out. Those burning monks, protesting the war in Vietnam, come to mind. Not a freaking peep, while they sat there cross-legged. I don't know that I understand human. Just last week I had a guy over 400 pounds, BMI 60. He was a hoarder and kept getting cellulitis in his legs because his house was so cluttered he kept hitting his legs into things and getting cuts and infections. When he came in, we had to remove his socks with scissors because he hadn't taken them off in over 3 months. His socks had embedded into his skin and somehow become one. I didn't learn in medical school how that happens. Had a lady come to the morgue in pieces for several days. She had fallen off a catwalk thing into an industrial fan that had no guards due to a cleaning being performed on that area in a factory. They were having trouble finding all of her. It wasn't explained to me until 3 days after the first piece showed up, so I thought there was a serial killer out there for a bit. I didn't see morgue the first time I read that and was very confused. My friend is a doctor and worked in Africa for some time. You can imagine, the hospital itself was a house. You could also have a school in. If no doctor had time, even the janitor would stitch you up. One day, 2 people came in, one with an axe in the head. Surprisingly, he was still alive. When trying to get the operation prepared, my friend asked the other guy without an axe in the head who he was. Brother? Cousin? Dad? Friend? No, neither of them. He was the owner of the axe and just wanted his freaking axe back. Nurse here. Had a patient come in due to pain in her chest 4 months after having a mastectomy. When we changed her dressings, the site was so infected that I could see her lung inflating when she took a breath. She died a week later. Still don't know why she didn't come in earlier. Bro, I can't even begin to imagine how painful that had to be. Heartbreaking that she died. A PA I work with saw this patient with an external fixator. Normally these are odds and screws outside the body holding a fracture stable until swelling or what have you goes down so they can operate and internally fix the fracture. They're normally on for a few days. Cut to this guy's office where a patient walks in one day with an X-fix on his leg that has been there for 3 freaking years. The guy lived a normal life and just thought it was the way they fixed legs. How he never got an infection I'll never understand. I've heard surgeons refer to the trauma unit as relentlessly working directly against natural selection. Use your imagination. They've seen a lot of Darwin Award candidates. Post-surgical nurse here. Had a guy with necrotizing fasciitis, flesh-eating bacteria, on his scrotum. Had a wound vac that kept leaking. I had to change it. Was not pretty. By the end of it we were both traumatized. I'll never forget the agony that poor guy had to go through. But, on a good note, he healed up eventually. This is often called Fernie's gangrene, and as you may imagine, it's pretty bad. A farmer from a rural area was using a table saw on a hillside. In the midst of cutting wood to build a shed, he slipped on the hillside and lopped off his penis. How plausible this is, whether he was lying we will never know. Rather than seek medical attention, he takes a castration ring used to stop bleeding from castrated goats he kept on the property and shoved it down around the stump. If that isn't bad enough, he also began to have horrific swelling and decided to use a rabbit water bottle feeder, the kind you see in pet stores, to prop open his urethra so he could pee. He stayed like that for 3 days until he started to have fevers, redness, swelling, etc. due to infection. When he got to the triage nurse called the urology team. We have pictures. Basically what ended up happening was his urethra was translocated to his perineum so he could still urinate, and his infected, necrotic penis was excised alone with a portion of his scrotum due to the severe cellulitis in the area. He ended up making a full recovery after skin grafting to the area. A farmer from a rural area was using a table saw on a hillside. You just know it's going downhill from here. Work in the ED as a medical student. Had a guy the other day who let a leg infection get worse for years, and when he finally came in his infected leg was at least 4 times the size of the other one and was draining copious amounts of foul smelling pus. If the infection had been seen earlier, he would have just needed antibiotics. Because he waited so long, he's going to lose the leg, if not his life. Not me, but a nurse friend. Guy comes in complaining of pain sitting down, pain in his rectal area. She goes to take a look and this man's anus is so infected it was almost gangrenous. The infection wasn't just around the anus, it had traveled inches deep into his body, literally using pus. One nurse had to excuse herself and almost passed out due to the smell. I was told, no idea what caused it or whatever happened to the poor guy. Probably injecting drugs Swamp of Dagobah style. 70-year-old guy came into the VA clinic for a bad cough and admitted due to temp of 104F. He was mine and I found lumps on his neck on exam. He had tuberculosis, scrofula, So, why does he have TB in the US? We do HIV test and he's been with some prostitutes. He also developed some other complications and was finally discharged after 4 weeks. Poor guy got a cough from sex. My cousin is a paramedic in a large city and had these stories. 1. Victim is a powerlifter with a home gym. Tries to squat too much weight, and on the upward push herniates his sphincter. When he got there the man had 6-8 inches of his small intestine coming out of his ass. Apparently the medical street slang for this is red socking yourself. 2. Victim is a man with a flashing fetish. Late in the night, he walks to a 7-Eleven, waits until the female cashier turns her back, and then opens his jacket so his erect member is lying on the glass countertop by the register. In a panic, the cashier grabs the first thing she could find, a can of tomato soup, and in an adrenaline rage brings the can down on his erect penis. He said this apparently almost entirely severs the man's penis, which fully erect is moving a lot of blood through it. He said the man nearly bled to death and the 7-Eleven looked like a murder scene when they arrived. Please don't think about doing M's unless you're willing to see some truly horrifying crap. I have seen all manner of weird and wonderful things, yet the most perplexing was a young girl we nursed in PICU with history of pica. When we took her for x-rays, due to her complaining her stomach was hurting, we found a belt buckle, a full-size spoon and butter knife as well as an assortment of batteries. As far as I recall, as it was some time ago now, they had to operate immediately to remove, and again if I recall correctly it was the batteries they were most concerned about, as if one exploded started leaking it would have caused irreparable damage. I have never seen a set of x-rays like it, and seeing was believing. Incredible how the heck she managed to get them in there, but never underestimate the willpower of psychosis. This thread taught me what a million anti-drug commercials in high school couldn't. I'm not a doc but a medical technician. Still in college, but you see some crap nevertheless. There was a guy who had a car accident damaging his cervical spine. Our occipital surgeon did an amazing job, so after a long process of recovery the man was able to walk using only a cane. Another problem he had was some neurologic muscle illness, not sure if myasthenia gravis or something else, which made it hard for him to do any fine motor movements. Although he had all these health issues, the guy insisted that he is independent, so he did all of his daily activities on his own. The problem occurred when he went to his beach house on a vacation and went to take a bath. He lied into the tub and turned the water on. Then he turned on the hot water and realized that the faucet isn't the same as he had back at home, and because of his motor skills being bad he didn't manage to turn the hot water off. Result: 2 3-degree burns on the left side of his body, from head to toe as he was laying on his side. He almost cooked himself to death. I don't even get in the tub in my own house without testing the water first. It's just not comfortable, even because you're sort of wet and cold. My doctor was very confused how 9-year-old me managed to completely rip my big toe's nail out at 3 AM. I tripped running down the hallway on the way back from the toilet, cause you know monsters, and slid along my carpeted hallway. The friction between my toe and the carpet ripped it out. OMG, I think I just shaved 3 years off my life by reading this. A very tame example, but here's one. Mum, an ex-nurse, told me one day a patient came in who had basically no social interaction whatsoever, so he looked like a complete mess, with hair nearly down to his hips. As the nurses cleaned him up they noticed his hair was quite thick around his head, and they couldn't cut through it. Turned out the guy had been wearing a beanie for the last 10 years and his hair had just grown through it and over it. Wow, I wish there were pictures on this one. I've had a patient with myiasis on the nose, who had flies coming out of his nose. Number. Doctors of Reddit, what is the most weird thing a patient has tried to convince you about? Pediatrician here. On mobile. English is not my first language, etc. When I was in my residency we had a little girl, 7 or 8 years old, who was admitted for a supposed psychiatric breakout. She was on antipsychotic drugs as outpatient. The mother said that she had a lot of psychiatric traits and conducts etc, which we found odd because she was a quiet and sweet child. We started weaning her off the medication and she was the sweetest child imaginable. Turns out the mother had been making up the symptoms, even managed to fool mental health professionals before we met the patient. Subsequently things got judicialized. They lost custody and last time we heard of her the girl was doing well. This is a condition called medical abuse by proxy. formerly known as Munchausen syndrome, where basically the people who have it crave the attention a fabricated disease gives them. Oh wow, as an adult who takes an antipsychotic and has trouble with the side effects, I cannot imagine how awful it must have been for that little girl. She must have felt so lost with everyone telling her she was ill and not knowing why. I was an EMT, not a doctor, but we got a call for a woman who felt dizzy and weak. This was in the middle of the summer. She had horses she cared for and spent all day out in the field. She was severely dehydrated and we asked her how much water she had drank so far that day. She said none, but she had 6 cups of coffee. This was around 12:01 p.m. We tried to explain to her why she needs to drink water, but she wouldn't listen. She said she only likes to drink black coffee. She kept trying to blame her feeling weak and dizzy on some BBQ she had eaten. This went on for about 15-20 minutes. In that time she drank half a glass of water. We got an AMA signature from her and left since she didn't want to go to the hospital and there was nothing else we could do. It became a running joke at the squad station. If anyone ever felt sick, we would blame it on BBQ. It's still shocking to me how many people refuse to drink water. My brother works at a lumber mill and says that he's never seen 2/3 of his co-workers drink anything other than soda. They also complain about how crappy they feel on a regular basis. Emergency department doctor here. I once had a young male patient walk in, after sitting comfortably in the waiting room for over an hour, with no obvious injuries but complaining of severe leg pain that just started for no reason. He then told me that he was allergic to everything except IV morphine and ketamine. My eyebrows obviously went up because he spent the next 5 minutes desperately trying to convince me about these allergies before giving up and walking out of the department, with no pain whatsoever. Later found out that he's tried this in multiple nearby departments. We would have those patients come in and after some appearance of thoughtful consideration, we'd tell them we'd give them a powerful painkiller called Dolabid. We would intentionally mispronounce it to rhyme with Dilaudid. After an hour, these people would look like they were higher than a kite. Dilaudid is a powerful narcotic. Dolabid is an NSAID like Advil. I am not a doctor but have a friend who is an emergency medicine doctor. Hopefully I can do this story right because it is absolutely hilarious. So my friend had only a few hours left in his shift when a young man came in with his older mother or grandmother. He came in complaining he had something up his bum and could not get it out. My friend finally got him to answer what it was, and it was a summer sausage his mother got for Christmas. He gives him some pain meds and begins to try and remove it. He tried with one hand but he couldn't get his fingers around it and kept on sliding further up his anus. Then he tried using 2 hands and was trying to receive this sausage like a quarterback would from a center. He said the whole time the dude was moaning and couldn't tell if he was enjoying it or was in pain. The whole time the sausage keeps sliding out of his hands and further up this guy's butt when the nurse with him starts yelling gloves. My friend had his hands so deep in this dude's butt he was about to go past the point his gloves cover his hands. He then decides to use forceps you'd use for retrieving objects out of someone's throat. He finally gets a hold of it from the front of the sausage and finally pulled it out. My friend was so relieved he could finally be done with this nightmare until he looks down and red fluid is leaking out of this man's butt. He assumed he must have punctured his rectum, but here if you leave a summer sausage in your butt that has a red casing for hours, it basically makes a gravy of disgustingness. His relief was already there for him and he finished up with the sausage man and left. He later received pictures from nurses with the sausage wrapped like a baby held by the nurses there with a weight and everything, and for several years after that would receive them in the mail or find them on his desk. That's the worst thing I've read all day. Not a doctor, but I work in an emergency room as a scribe, so I follow doctors around. One day, an ambulance brought this guy in straight from dialysis because he had become super mentally altered. He was just swaying his head back and forth and would only answer yes to every question. What year is it? Yes. After a couple hours, his wife showed up, and his toxicology screen results were ready some time after that. Lo and behold, he was on C. The doc asked the wife to leave the room and confronted him about the results. Guess what? He snapped out of his altered state and immediately tried to convince the doc to lie to his wife about the C. I've never seen someone beg like this before, especially after hours of only saying yes. The doctor essentially said tough crap, and that she wouldn't lie for somebody that wasted hours of her time. Another one. We had a patient in the being detained by the police. The problem was the patient was unresponsive. The attending walked over, picked up the patient's limp arm and held the hand over the patient's face and dropped it. His hand completely missed his face and fell to the bed beside him. A truly unconscious patient will not protect their face. He was immediately discharged to police custody and he walked out on his own. That they are allergic to every oral formulation of pain medication. That the natural treatment they just read about online while waiting to see me is better than anything I might offer. I can only do nasal pain medication. Proceeds to do a fat bong rip. A long time ago, I was convinced that tiny, bluish black parasites were feeding and living on my skin. I collected these buggers in a small jar, took them with me to the doctor. The doctor looked at them for half a second and told me it was lint. Okay, that made me laugh. For once the tiny bugs living on my skin were not psychosis. Dentist here. A patient once tried to convince me that he was being hunted by government agencies because of the information he had acquired over the years. That was placing a negative energy around and within himself which was causing his teeth to rot. This wasn't some crappy dental office either, it was in one of the most affluent neighborhoods of Chicago. Sounds like your patient was schizophrenic. Not a doctor but worked in as part of the initial treatment team. Patient had taken a pair of wired iPhone earbuds and stuck the plug end into his urethra, all the way up to where the cord splits into 2 wires for each earpiece. Said he passed out at a party, woke up to find it there and that his friends had done it to him while he was passed out. They couldn't be pulled out, had to have surgery to remove it. Why? What happens when you put those same headphones in your pocket and walk around for hours? They get tangled up to holy heck. The doctor I was with had seen this same guy a few weeks prior for the same thing but with a wire coat hanger. We managed to get him an appointment with a mental health professional shortly after. Had a friend who was an X-ray tech. She would have all the stories of how to position folk in their coat hangers. Not a doctor but when I was in the waiting room of the this elderly woman tried to convince the front desk that she broke 2-3 ribs. She kept laughing and chuckling with the doctors while talking to the doctors. I was in more pain with suspected appendicitis than she was. Safe to say she was fine and was discharged within 2 hours. Oh god, I broke 4 ribs about a year ago. Fell and landed hard on my left side on concrete steps. I couldn't breathe. I couldn't move. I couldn't have laughed if Stephen Fry had shown up in person. Getting into and out of the car was almost impossible and left my shaking, sweating and crying. It was awful. My wife just spent a year as a PA at an urgent care in an undereducated area. The amount of stories she has are in the thousands. One of my favorites is, I can't have COVID. Holds up Taco Bell bag. I just ate all these tacos. I don't know anyone with COVID that can eat all these tacos. Also, my daughter's friend's mom called me and told me her daughter has chlamydia and that everyone her daughter has been with needs to be told. So I'm brining in my daughter because they were in the same car together. My wife had to explain to him how STDs work. Lastly, I have the sugars. That's it. From now on I'm not drinking no more soda. From now on it's only Gatorade. That was a response to being told he has diabetes. The sugars. Love it. My Alabama grandma used to say this all the time. It's why I call trembling the shaky shakes as a full-on adult. Not a doctor but an old co-worker of mine was a drug addict and cut his forearm open on a chomp saw. He tried to convince everyone before he got pumped full of drugs by the EMTs that the top of the saw was broken off. It wasn't. And he was throwing wood over the top of it. He wasn't. And caught his forearm on top. Chomp saw. New favorite tool. A lady was trying to convince me she was having a stroke because she couldn't move her right arm. The only problem was that she demonstrated this by repeatedly shaking her right arm in my face saying, "See, I can't move it." I work for an attorney and we had a client come in once telling us he had paralysis of his left arm and leg as a result of the car accident he was in. He walked in on his own and spent the entire conversation flinging his arms around, gesturing with every word. About once a year the same person, from a different continent, emails my team claiming that exposure to bat droppings has left her with intense diarrhea, spontaneous orgasms and an allergy to pears. Not a doc, just kinda related. I had a patient try to convince me that he occasionally grew feathers from his head. I asked him if he had a down pillow or comforter. He said yes. but didn't get the correlation. Anesthesiology interventional pain specialist here. When I was a resident, my attending used to prescribe opioids, but back then, patients needed to sign prescription contracts and get regular urine drug testing done at the office. One lady showed up for a scheduled urine drug screen wearing an adult diaper, nonchalantly acting like she lost control of her bowels and didn't seek any medical intervention, clearly in an effort to not give a sample. Just casually wearing a diaper. Upon further questioning, even challenged us to check her diaper for excrement, which she assured us she was depositing in her diaper during the entire encounter. We referred her emergently to the for urgent neurosurgical eval because loss of bowel and bladder control could be a huge deal and indicate major spine injury. She declined and walked to the corner bus stop with a diaper full of crap and pee. Patient tried to convince me with very strong conviction, in full sentences of perfect English, that she didn't speak any English. She was convinced she was speaking a dead language that only her, me, and God could understand. I knew this comment section would be filled with stories about people shoving items in their holes. I came here to read what items they are and imagine how they did it. I too came here for the guess what's in my butthole stories. They're always hilarious in one way or another. So the patient is me in this case. Last week, as I was getting a dog toy from under the bed, my dog jumped off right as I was picking my head up. She landed with her paws on the back of my head and her claw sliced the back of my ear and tore open my earlobe. This created a pretty nasty laceration. I went to the ear and needed a number of stitches. It should have been simple, except no one believed me. 2 doctors and 2 nurse practitioners weren't convinced that this is how I received the injury. Even my dad was less than fully convinced at first. It truly was just a freak accident. Wrong place, wrong time. Still, nobody believed me. Psychologist here. I work psychiatric inpatient, so you can imagine the gamut of things patients try to convince me of daily. My personal favorites have been that they are pregnant with 99 fish babies, that they are actually a Supreme Court judge and king of Jupiter, and that there are angels in their urine sample so they need to do another one. I have so many more, but those are the most recent ones that come to mind. I'm posting on here a second time because more examples are coming to mind. Every patient ever has the most severe form of whatever diagnosis. The doctor said it's the worst fracture he's ever seen. I have end-stage fibromyalgia. I almost died from my pneumonia that was treated as an outpatient with antibiotics and no oxygen. Always have to tread carefully with how approach those subjects cause people will defend it to the death. Have a friend that's an OBGYN. She once had a patient claim that they were pregnant with a crypto pregnancy, which is apparently when people are convinced they are pregnant based on how they feel, I guess, despite all tests showing they are not in fact pregnant. It will probably not shock you that the patient had been through several doctors. Oh man, there's so much of that on obscure internet message boards. I went down the rabbit hole one day and found a crypto pregnancy support group. It was really crazy but sad at the same time. A guy once had pain in his belly and the doc told him to lift his arms and a TV remote just fell out. He was so fat it got stuck between his wrinkles. I volunteer at an STI clinic, not a doctor, and we always ask people if there's a reason why they came to get tested. I have heard so many misconceptions, but one of the more uncomfortable ones was that a young lady said her boyfriend insisted he got chlamydia from sharing a towel at the gym and that she should get tested just in case. I kindly explained to her how chlamydia is transmitted and gave her some brochures to take home with her and share with her boyfriend to discuss. I'm not a doctor, but a classmate was trying to convince the class that she had holes in her lungs. I mean, she's not wrong. It's really common for people to claim that they in fact have a fever despite not having a fever, because they are a low temperature person. Also, a woman claimed her uterus had wandered. I'm not a doc, but I'd order an ultrasound just to see where her uterus had wandered to. I wouldn't even disbelieve the patient to her face. Oh look, it came back. Dentist here. Many patients try to find excuses for their very poor mouth hygiene, and many try to convince me that it was because of an accident, when it is obviously not. Not a doctor, but I was in a very crowded emerg with my wife, waiting, nothing too serious. A giant dude in a muumuu was approached by a doctor. The patient was a frequent flyer was my guess. Doctor asked him what was going on. He begins with, I was diagnosed a lesbian. My landlord keeps me penniless. She comes into my place and takes my money. I'm taking estrogen but keep forgetting to take the pills. My daughter, she's in Buffalo. She comes to see me sometimes but she's busy. 6 minutes later the doctor says okay, what did you come to the hospital for? What is it you want? I hit my head and I need stronger pain medicine than Advil. The doctor walked off. I don't know if he got a script or not. Not a doctor, but I'm 12 and was in the hospital cause I went into diabetic ketoacidosis. Google it if you don't know what I'm talking about. And the one nurse said that since I have diabetes I can only drink like diet sodas and stuff that don't have sugar or carbs, and my dad tried to tell her that aspartame, an artificial sweetener, causes leukemia lol. On the other hand, have you ever had a pain or issue that seems so weird or hard to describe that the doctors look at you as if you're having a laugh or making it up? When I'm in pain, especially if I have had even a cocodamol, I can't describe things to make reasonable sense at all, and it always results in a yeah right look from the doctors, at least to start. Not a doctor, but worked in a hospital. I can't drink water, it makes me gag. Really whiny, needy person came in constantly complaining and wanting someone to listen to her talk about every painful experience of her life. Her BF ditched her as soon as she was in a hospital gown, and since she couldn't stand up for a while after the procedure, she kept insisting he had her coffee that she needed and we had to go searching for him. We offered alternatives, but water makes me gag. My best friend can't drink still water. She has PTSD from severe nausea and vomiting during pregnancy and it really does make her gag. I don't know how she survives. She drinks sparkling water and I guess that's enough. Not a doctor, but this guy tried to lie for a prescription for anxiety meds. He told the doctor he had frequent urination to warrant a checkup. He ends up getting a full-on prostate exam and gives a blood test. The guy faints upon being pricked with the needle, passing out long enough for the doctor to clock out. The guy did not get a prescription for anxiety meds. John Mulaney. Doctors overread it. What is the weirdest thing a patient wouldn't admit? I admitted a guy for chest pain. As part of the workup, I did a urine drug screen which came back positive for C. After the rest of his cardiac workup was negative, I said to him, good news, you didn't have a heart attack. It's likely that your chest pain was caused by C. His answer, I didn't use C. I was at a party and people had some lines of C out on a table. As I was walking by, an oscillating fan blew the C into my face, which is why my urine was positive. Got it? Yeah, cause parties with C on the table frequently have fans near the coke. Obligatory. Not a doctor, I'm a nurse. We had a patient come into the operating room for brain surgery. Probably a mid-50s guy with a nice head of light brown hair. Before a patient comes into the actual, we ask them a series of questions, including whether they have any implants, jewelry, non-hospital clothes on, etc. Guy says no to all the questions. After the patient gets put to sleep, the surgeon grabbed his hair to start shaving it off. Because you know, brain surgery, and all his hair peeled off because he was wearing a wig and didn't tell us. We almost shaved his hairpiece because he wouldn't admit to anyone he wore it. Nurse here, had parents bring their 3-year-old son to the emergency department for 1 month of abdominal pain that kept getting worse. I ask all the routine questions for this complaint. Lots of questions about his poop. Is it bloody? Diarrhea? Mucus? When was his last bowel movement? Any changes in the stool? They deny any other concerning symptoms but abdominal pain. We do blood work, ultrasound, x-ray. Everything comes back completely normal but the kid is intermittently screaming in pain, curled in a ball. Over the next 5 hours I continue to repeat the same questions. I asked repeatedly if there was anything else going on that they could think of. Nope. The kid just doesn't seem well but we have no reason to keep him. We decide to watch him a little longer, let him eat. The kid eats a bunch. A PBJ, apple juice, crackers, popsicle. No pain so we decide to send them home. I bring in the discharge paperwork and I'm about to start going over instructions and the dad goes, you know, for the past 3 months he's had a lot of worms in his poop. Worms. Freaking worms. You spent 6+ hours denying worms. I literally just turned around and walked out of the room without saying a word. I was laughing almost to the point of tears. Could not wait to tell my resident. Deworming medications, a crap load of wasted time, and they were on their way. Seems like dad was embarrassed to have known and ignored it, so he wanted the hospital to find out on their own so that he could act surprised and save face. I'm a pediatric dentist, so maybe not the type of doctor you were looking for, but this one throws me for a loop every time, so I'll share it. When I sedate kids they have to be NPO for 8 hours before, so I always ask if they had anything to eat or drink in the morning. Parents never want to admit their kid ate or drank, even when I remind them it's very important because if they vomit and aspirate they could die. Often they try to minimize it and say it was just a few bites, but one kid walked in eating a bag of Cheetos at reception and then the parent insisted to me that they hadn't eaten. Yeah, I'm 100% not sedating your child today. Obligatory not a doctor. Used to work PR and marketing in an inner city hospital. Was once hanging out with the folks when a regular came in. He was into self-harm. This would have been in 2001 or so and I was young, so I had never even heard of this. This guy had spent hours burying a Phillips head screwdriver in his abdomen, carefully working it around major organs. He was a Vietnam medic and had some training, so he could feasibly do it. He straight up said, "What screwdriver? You all are crazy." The attending was staring right at the x-ray and the handle of the screwdriver sticking out of his abdomen. The screwdriver must have been 4 inches long. I still shudder. I once had a patient come in with large calluses on the front of his ankles, which is a very unusual place to get calluses. I brought it up a few times because I thought maybe he was wearing his shoe wear improperly, but he kept waving off the question. Eventually I got him to admit that the calluses are there because he recently started taking a prescription antidepressant medication which made it very difficult for him to achieve orgasm. He found that if he lay on his living room carpet with his legs bent out beneath him in a W fashion and jerked off for several hours he was able to achieve orgasm. Had a patient in hospital, I forget what for. The point is that he disappeared for a few hours. When he came back he was tachycardic to 160 BPM, massive pupils, couldn't sit still. We asked him what he'd taken while he was out. Nothing, he swears. He went to the pub and just drank lemonade. Okay, we say, we're gonna take some blood and find out what you've taken. He then pipes up the friends he was with would think it was funny to spike his drink. What? We asked, did he think they might have spiked his drink with speed? He says, what do you know? Bloods confirmed that he had taken speed, but he insists he didn't take it, his drink was spiked. Ah, the ole speedy be a slipperoo. All my friends play this trick on each. It's hilarious. I'm a nurse. I had a kid once who I needed to get a urine sample from. He was 8. I gave him a cup and pointed him to the bathroom. I went to check on my other patients and came back. Kid was still in the bathroom. I go knock on the door. Hey buddy, you okay in there? Sink on full blast. Yep, everything's fine. I go back to his room a few minutes later and he hands me a bag full of water with a cup inside that also appears to be water. I pour the water out of the bag. Hey buddy, are you sure this is urine in this cup? Yay. My pee is always clear. PT is wheeled off the x-ray. I check the temperature of the so-called urine in the cup. It was ironically the same temperature as the water from the faucet. Come on little homie, you gotta do better than that. That she could actually see. We had this lady that came into the ER at least once per month, usually cheek pain. She was 30s, morbidly obese. She had seen multiple specialists. Had her heart, lungs, GI system examined in almost every conceivable way. One night she comes in with sudden onset blindness. Not her first time with this complaint either. Last time she got a trip to the retina specialist. When I examine her I walk around her bed and she tells her friend to get her feet off the chair so I can get by. She plays it off super cool by adding, if you have your feet up like you always do. Then the neuro exam. I have her touch her nose then touch my finger. Her idea of how a blind person would perform this exam is to touch her nose then wobble her hand from side to side as she touched the end of my finger. Not to mention the near constant eye contact as we talked. I would ask a question and start moving while she talked and she would follow my eye perfectly. She was extremely relieved to find out she had conversion disorder and that her sight would be back soon. Maybe it was factitious disorder. I tend to believe all her chest pains and crazy complaints were real feelings she was having due to a number of her social psych issues. In the year at midnight it's a lot easier to tell her it is a symptom of dealing with whatever social drama was happening in her life and that her eyes worked fine instead of telling her she was lying to me for some gain. Either way she was sick and needed reassurance. She was genuinely relieved though. On the finger to nose test she touched my finger on the first try but instead of a straight line she moved her hand back and forth about the 3 inches the whole way there but directly there. My finger was probably 2 feet in front of her face. One of my favorite patients had conversion disorder. She thought she was paralyzed on her right side. I watched her wipe away a very real tear with her right hand when she was distracted. She really didn't realize she wasn't paralyzed. This one happened just the other day. Had a patient come in looking pretty sick. Labs and vitals said the guy was in sepsis and most likely had a bad infection. The question was where. After some prodding and letting him know the seriousness of his situation he finally admitted to the source of his infection. He didn't want to say it so he just pointed between his legs. Looking underneath his underwear revealed a smelly, red, swollen, pus draining scrotum. Some of it was even black and necrotic. Not a pleasant sight and it looked horribly painful. He went on to explain that he had a painful lump on one of his testicles a few weeks back. He was told it was an infection and given antibiotics. The problem didn't go away and by then he had decided to take matters into his own hands. Literally, he tied a string tight around one testicle and proceeded to cut it out himself. Needless to say it became horribly infected and was going to require surgical intervention. Guy ended up doing okay. I'm a CT tech and I was to scan a woman's abdomen for belly pain. She and her girlfriend were there. I have to have a pregnancy test. I have to have one done. I can't radiate a fetus. I even ask none so no exceptions. She denies up and down she's pregnant. And then, after the test I did, it said she was. She denied it and demanded a blood test, since she was a lesbian and never has fricked men. Well, the blood test came back positive also. Surprise. And the argument that ensued was biblical. She was arguing with her girlfriend and the nurses and the doctor. I never ended up scanning her and they chalked up her pain to her being pregnant. The look on her girlfriend's face when I said it came back positive was one I will never forget. The woman in the room with the patient was her so and they had been together a long time, and the patient had given her so permission, in writing, to allow her to hear her medical information. Many of you might say you shouldn't have told her in front of her so and you're partially right in a way, but the patient had given her so that permission, and I did not question it. Had she not, I would have asked her so to leave the room. You can give anyone you deem necessary access, or no access, to your medical information. It's not limited to spouses. My friend rented out a room to 2 lesbians once. After kicking them out, she found about 5 or so negative pregnancy tests hidden under the mattress. We all knew which girl they belonged to. She had a guy over a lot, claiming he was just a friend. I feel bad for the other girl. She was super nice. Had an elderly lady from a nursing home come and super altered. She would wake up briefly to answer questions but then would be out like a light seconds later. Usually in this case we assume it's an infection, stroke, etc. But we still ask about drug use, legal and illicit, since it can cause that kind of thing. Lady denied several times she didn't take anything other than prescribed meds. Finally, as we're about to intubate her, put her on a ventilator. Since she was getting worse, we cut off her bra and out pops a little baggie with some white powder and a baby straw. We gave her some Narcan and she gasps herself awake. Even after that still took her a long time before she said well maybe I did take some drugs from a friend. Since then I've trusted no one when it comes to denying drug use. Just to clarify, I'm not saying I think everyone is a drug addict. I'm just saying if you come in acting super out of it, you're probably going to get Narcan just to cover all the bases. Also, I'm aware that light seconds are not a measure of time. I used the phrase out like a light followed by the word seconds. Just confusingly worded I guess. Crap, At least she admitted it after the Narcan. I'd say 90% of the patients I saw revived with Narcan and they are still denied taking opiates. I'm an internal medicine resident. Had a patient with sepsis that was being seen by the urology department. When I first read his clinical history, it stated something along the lines of infected wound in the dong. Patient claims he doesn't know how he got it, so I begin my assessment and ask him about his wound. Indeed, he claimed he didn't know how it happened. I decided that the priority was to stabilize the patient and I made some adjustments to antibiotics and other meds. Well, the guy went downhill. The sepsis became severe even though he was with the strongest antibiotics we had and 2 different vasopressors. His blood pressure was through the floor and eventually he needed intubation and went to the ICU. He managed to survive after a complete penectomy, and about 2 weeks later I saw him again. Turns out the dude was trying to get his dog to lick his dong, and put on some peanut butter on it. Naturally the dog bit him. He didn't seek medical help for about 10 days before the pain and fever was too much. If we knew from the beginning that the wound was inflicted that way, the antibiotic would have been different. Probably would have made a difference. I still feel sorry for that guy, but with a wound like that he is lucky to be alive. I should have said that a total penectomy is total removal of the dong. Sorry for all of you that went to Google Images. I'm a nurse, not a doctor, but it's amazing how many patients lie about how much they drink. Dude, we aren't judging you. We just want to know if we need to worry about you detoxing when you come out of open heart, or any other surgery, etc. A lot of comments in here seem to be about your personal doctor visits. My comment was very specifically referring to major surgery. All I am saying is this: if you're going to land in the hospital for a significant amount of time and you're an alcoholic, it is to your benefit and safety to be honest about that, because the odds that you will withdraw in your time there is high. If providers know, they can plan to manage that so you don't withdraw. Last, sounds like a lot of you have run into crappy, judgy people in healthcare. We aren't all like that, and even the judgy ones really don't want you to detox on their shift. Had a patient on our service for a heart failure exacerbation. We weren't sure why she had one now as she had been stable for a few years prior. She also had a documented past use of crack-C, so we checked a urine drug screen. The screen was positive and the next day I rounded on her. She asked me why she had the exacerbation. I told her it was likely due to the HER-C use. She was shocked that I would accuse her of using. I brought up her positive drug test and she insisted it was a false positive and told me she must have picked up the false positive from a toilet seat. That's not how any of this works. Not a doctor but my husband. He had a 17-year-old girl with abdominal pains come into the OR with her mum. Turns out she's in full-blown labor. Assures them she can't be pregnant. She's a virgin. The baby is literally crowning right there in an OR maternity ward in their hospital and she was in advanced labor when she arrived. And she still insists she's a virgin. My husband was the doctor, not the 17-year-old girl. Ha. My mother is a nurse and told me about the time some lady came in for abdominal pains as well. Yep, she was pregnant and gave birth and as soon as the baby was out she screamed, "It's not mine." Mom responded with, "It didn't come out of me." Not a doctor, but worked in a hospital for a long time. Had a PT come in that had OD on H, was able to get him set on that front. However, he had necrotizing fasciitis in his pectoral from injecting there. He was septic and honestly a bit of an butthole. He kept trying to tell us the reason he was there was because of a motorcycle accident. We all knew but he was in absolute denial. He eventually heals up and transfers out. After a couple months, he came back about 6 months later to say thank you to all of us and to apologize for all the lies and asholish behavior. Seems it was enough to get him out of that life and onto a new one. I think about him now and then and hope he stayed clean. On my surgery rotation as a med student, warning this is gross as frick, had a patient recovering from having parts of their bowel removed. As part of the recovery their intestines weren't completely connected to let them heal better, so the intestines were connected to a little hole in the skin with a bag attached for the poop to go into, known as a colostomy bag. For reference, this woman was in her late 60s and over 230 pounds. I had to round on her every day, and every single day I'd walk into her laying in bed absolutely covered in toxic gasoline smelling diarrhea. She also had C. Diff. A nasty bacteria that anyone in the hospital can identify by smell, and she would flirt with the residents and make casual conversation while we would clean the crap off of her and fix her ostomy bag. One day we walked up to the room and the chief resident walked in the room, immediately walked back out and closed the door behind him, looked up to all of us following him and went cheese fingering herself covered in crap. I really wish I was making this up. So yeah, she never admitted it, but obviously she was freaking tearing at all the tape covering her ostomy all night until she broke the seal and could get herself covered in crap again to get attention from the doctors. Answer for some questions here. 1. At what hospitals do doctors have to deal with ostomies? Crappy ones. 2. What happened to the patient? No idea. After having her for around 2 weeks my rotation ended and I was relieved of my duty. 3. I can't think of any more poop puns. 4. I did not witness a fingering, but I believe the exact term that was used was fricking flicking her bean. 5. She was not mentally disabled in any way and was completely alert and oriented. She wanted attention from the doctors. One resident in particular was her favorite, and figured out how to get it. 6. Why didn't the nurses deal with it? I have no idea. I was a brand new third year student on my first rotation and just figured that's the way things were. After the first week the attending was even coming to the room to secure the ostomy since it kept coming undone. Don't know where this is coming from that people are saying only nurses deal with ostomies. Well, that's it for me folks. Not a doctor, but many years ago was working as an assistant to an occupational therapist. We got a call out to help mobilize a woman who had been morbidly obese and was told to lose weight. We learned from the daughter she had gained weight, but her mother would refuse to come clean on what she was eating. All the daughter knew was that her mother may have been eating deep fried food due to the vast amounts of cooking oil she found in the pantry. When we arrived, she had gained an extra 6 kilos but insisted she had lost weight. She did not look it. Before we began mobilizing her and check her living room for trip hazards, she also had horrendous knees. We took a look at the pantry. Olive oil, peanut oil, sesame oil, any kind of common cooking oil you can find off a supermarket shelf. She had it. A vast stockpile of oil. We asked what she was frying with the oil. She insisted that she wasn't frying anything and that she was eating healthy since the oils she used were healthy. We had to explain to her that oils are still fatty and will still contribute to weight gain. After a bit of poking around the pantry, I noticed that for the amount of oil she had very little in food that could be traditionally fried. She also had little in other foodstuffs that could explain the obesity. I brought it up with the therapist and the therapist then demanded the truth. We couldn't provide complete healthcare until we knew everything. She admitted that she thought healthy oils would help her lose weight and suppress the appetite, so she had taken to drinking the bottles of oil whenever she got hungry. Needless to say, we disposed of most of the bottle of oil and set her up for a home visit with a dietitian. Not a doctor, but work in an ER. One day some pretty young parents brought their toddler in because he was super lethargic and not responding to any stimuli, and the parents said they had no idea why. The staff were pretty concerned for him because those symptoms are a pretty big red flag for small kids. So we start running a bunch of tests including a drug screen which ended up being positive for THC. The doc goes and talks to the parents about it and they finally broke down and admitted that the kid had eaten an entire bottle of their weed gummies while they weren't paying attention a few hours earlier and was just high as crap, lol. Work in an ER. This literally just happened to us this past week. Except the parents never admitted to how the kid got a hold of weed. Like, she's 14 months old, she's not toking that crap herself, but. Trauma surgery rotation. Surgeons are helicoptered out to the scene where a man is impaled on a tree. They are hoisted up to cut him down in conjunction with firemen. The branch lodged deep in his butt and the surgeons return on helicopter. In the ED, straight to CT for pan scan. It's in there. As in through his glut max, minutes, pelvic alar, and the tip of this branch is lodged somewhere alarmingly close to the bifurcation of the iliac, external and internal. He's hemodynamically stable and talking, saying "Mas, I need meds." A doc is like, "No crap." Asks him, "What were you doing in the tree?" His answer, "I used to trim trees." Okay, but were you doing that today? No, but I used to trim trees. Utox is positive for M, but it's time to get that baby out, so it's stat or for IND and X slap ish. I get to scrub in and see what it's all about in the OR. The branch is indeed lodged between the iliac artery and vein. At the bifurcation, neither vessel is damaged. We proceed to remove wood chips and bone chips from the enormous hole we have excavated out of his butt, and no suturing practice for me because it's a wound vac for this man, who used to trim trees. In the following days he is in and out of a med-induced haze. We ask him over and over, yo, but what were you doing in the trees? His reply, I used to trim trees. He came clean about the MUs and other drug use. He started to look better and better as he basically detoxed before our eyes. He eventually left in as good health as one can be with a giant mass of granulation tissue where your butt used to be. Never told us why the frick he was in that tree. That man wanted to frick a tree, and by God he did it. A story that resides at the nexus of oncology and psychiatry. Middle-aged man enterer in sweatpants. Worked as an accountant but currently unemployed. He tells me that a urologist had diagnosed him with inflammation of his epididymis 3 years earlier, but he hadn't followed through on the treatment, and that he now wanted to get things taken care of. During the physical exam I see a grapefruit-sized mass in his scrotum. It was not subtle in any way. I call in urology and order a CT scan. I tell the guy that this isn't inflammation. It is a tumor and we need to do more tests to find out what type of tumor. He stops me and tells me he didn't understand what I had said. Could I please repeat it? Then he pulls out a pad of paper and writes down my exact words and sits there staring at the words for a few minutes. I just felt really sorry for the guy. Doctors of Reddit, what was your dumbest I am Verismit patient experience? RN here. I see some crazy stuff, but one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 pounds. Diabetic, heart disease, you name it. Anyhow, I'm at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes and he starts complaining that he's thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams no, no water. He's allergic to water. Well, this is gonna be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at the hospital with him. Was working at a clinic. I was speaking with a non-controlled diabetic patient about her sugar intake and she said she drinks a 32-ounce soda every day. I ask her if it's regular or diet and she replies with it's half regular. I let the ice melt first so there isn't as much sugar in it. Sorry, but that isn't how it works. I have had several arguments with diabetics about Coke Kool-Aid sweet tea versus those made with artificial sugar. I tell them, look, don't drink sugar. If you have to have something like that, use an artificial sweetener. No way. That stuff is poison. It will kill me, mom. Your A1C is 14. Sugar is already killing you. I had a patient who was a completely non-compliant diabetic, smoker, morbidly obese, who had his first heart attack at 45. His blood pressure was also super high, and instead of taking his antihypertensive medications, he went to the gym. In the gym, he would sit in the sauna for a very long time, and sweat a lot, and lower his blood pressure by becoming dehydrated. I have one. I got this from my friend, who is a doctor on the children's ward in a rural hospital. These parents bring in their child whose hair is infested with lice. The lice was visible to the naked eye and could be seen crawling on the child's clothing. While the medical staff examined the child, in order to determine a course of action, they discovered the child was covered in a white powder and smelled heavily of chemicals. They asked the parents what were the substances and the smells emanating from the child. The parents said, quite matter of fact, it was Savine powder and flea and tick spray they used on their dogs on the family's farm. Needless to say, social workers were notified about this case. Had a neighbor in rural TN who was convinced that the best way to treat her child's head lice was to comb diesel fuel through it, and that doing it in an enclosed living room while smoking cigarettes was acceptable. She was baffled when CPS took her kid away. 70-year female tripped and fell 2 days ago. She came in with hip pain but reports after the fall her nose was bleeding. She had landed on her nose. About a year prior her dentist had messes up an infraorbital nerve block and caused some swelling in that region, but that all was resolved. This old lady is now convinced her nosebleed after falling on her face is related to an infection from the dental issue a year ago. After multiple back and forth on the etiology of the nosebleed, she became the first patient I raised my voice and put down an authoritative "No, you are wrong. Just stop it." This has got to be the medical equivalent to the update you installed on the computer a year ago is making it run funny. Get over here and fix it. I work for an optometrist and it was the month before school started and a woman brought in her son to have his eyes checked for the first time. Seems like a pretty reasonable thing for any parent, even if he was a little older than usual for a first eye exam. Better late than never, I guess. The mom was well spoken and appeared fairly intelligent. Everything went as normal. The doctor examined the boy and ended up prescribing glasses. When the doctor was explaining to the mom that her son had to wear his glasses all the time since he's nearsighted and basically can't see clearly past 5 feet in front of him, and will definitely need glasses for school. For some reason this caused a switch to flip in the moment she spazzed out on the doctor, saying that her son doesn't need glasses and that the doctor is only saying that he does because he wants to sell glasses. She says that she only brought her son in because there was some form for school that needed to be filled out and that doctors are all a con artist trying to push unnecessary medications and interventions. The doctor tried to calm her down and explain that he's only trying to help them but that she was free to get a second opinion and gave her a copy of the kid's prescription and sent them on their way. About 4 months later the lady is back asking for another copy of her son's prescription. Apparently the first semester midterm results were in, and her son failed them all because he couldn't see the board in his classes and needs glasses. Not a doctor but I'm a nurse who worked in the or at a trauma center, was doing surgery on a 19-year-old who tested positive for MNC who was grilling the anesthesiologist about every drug we were going to use in surgery because he doesn't like putting chemicals in his body. Gotta stick with that organic, fair trade, non-GMO Coke. Most of my own stories go along similar lines to patient has chest pain driving a coach load of school children. Thinks it's indigestion. Swigs bottle of Gaviscon. Later diagnosed with a huge heart attack. My favorite ever story from a colleague. A patient comes into A&E with abdominal pain. As part of the workup he gets an abdominal x-ray which shows the problem as clear as day. The colleague has then proceeded to remove, from the patient's rectum, an 8-inch replica of Nelson's column, the statue in the center of Trafalgar Square, London. On showing it to the patient, the response was, "Oh, that's Nelson. He lives up there." I've got 2 stories that stick out in my mind. The first is the mother of a toddler who came into emerg. The kid had cruddy green bloody stuff coming out of his left nostril, and a lot of redness and swelling of only the left side of his nose and the adjacent cheek. Mum was sure he caught a sinus infection and just wanted some antibiotics. Now I know some kids like shoving whatever will fit into their body orifices, and that this was more than likely given the one-sided nature of his condition. But mom was insistent that he never puts things in his nose. It took some convincing, but I finally got her to let me take a look. Gave a squirt of midazolam in the good nostril to settle him, then dug with some tweezers through the crud until I pulled out a big Olay button battery. It would have been burning his nose for a couple days. Hopefully he healed up well. Side note, if a kid swallows a button battery, it can do a similar thing to their esophagus. This is an emergency and needs to be dealt with ASAP. Patient had a hard time getting pregnant. Finally conceived but miscarried. Patient has a D&C so she can try again, this time with medical intervention. We monitor her blood to ensure the pregnancy hormone is gone before beginning treatment, but she keeps coming back with higher levels of hormone. Docs are worried because she might have some retained placenta or pituitary disorder and this could be super bad for future fertility. We call her in for a conversation about the hormone levels not going away. After talking together about what might be wrong, they are going to go home and think about further tests. She said, "I need to go. I have an appointment at the weight loss center for an HCG shot." Turns out that she is on the HCG diet. HCG is the pregnancy hormone. And this was after an hour of the docs saying, "We don't know why you have these constant higher levels of HCG in your blood and we are worried." Patient inquiring about birth control was adamant she wanted an IUD. I mean, she probably wouldn't get pregnant after that. Had a young woman with recurring UTIs that began after a recent partner and with no STDs. Went through the standard questions trying to figure out what could be causing them and eventually found out she had been lubricating with jelly, not KY jelly. The mix-up had literally been a joke on house. It took me some effort to keep a straight face, but we eventually resolved the problem and she stopped getting UTIs. Oh lord, I'm British so didn't think jam straight away and was just imagining someone trying to get jello type jelly to stick to their bits. Oh, I have two good ones that come to mind. Clinical pharmacist here BTW with one story in the ear and one in the pharmacy. A physician told me this one. 16-year-old boy presented to the ear with an extremely swollen discolored penis. Apparently he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own penis. He thought that adding blood would help increase his size. His penis was terribly infected and he was hospitalized for a week or so. 2. One day in the pharmacy, a girl comes to the counter requesting a refill for her birth control. We pulled up her profile and realized we couldn't refill it because she just got a 28-day fill less than 2 weeks ago. When we asked what happened to the other one, she said she was out. Apparently, both her and her boyfriend were each taking a pill each and was adamant that was how they needed to prevent pregnancy. Apparently he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own penis. His penis was terribly infected and he was hospitalized for a week or so. Frick, that is just gruesome. I work in the ear. We had a very pregnant patient come in needing stitches in her vagina. Turns out she was a realtor and didn't want her water to break while she was showing a house, so she put a glass cup in her pants to catch the water. Instead of using a pad or an adult diaper, she went for a glass cup. She sat down while showing a house and sure enough, it broke and cut her up pretty bad. Between the guy putting arm blood into his penis and now this, I don't think I'm gonna see my genitals again for a couple of days. I'm a corpsman, not a doctor, but I once had a patient tell me that there was no credible research that smoking was bad for one's health. Okay. 80 plus YO. Patient who was declining with multiple diagnoses and about 3 decubitus ulcers. Daughter was adamant that her father be kept on his strict paleo diet because that would supercharge his healing. She had a stack of diet books. He simply wasn't getting enough nutrition to heal the ulcers. He didn't like the diet at all. BTW. At some point you kind of have to stop being polite and just tell patients' family members bluntly that you don't have time for this crap and what you recommend and they can do what they want and just document everything. It happens a lot but she sticks out. I am a dental student. One patient in particular is pathological liar. During one visit, they claimed to have gone to medical school. Next visit was that they did dental army. Last visit was that they had a PhD. The patient will say things like, "Hey doc, do you need me to move my head mesial or distal number? I need you to move your head right. Hey doc, are these cavities being caused by the anaerobic pathology microbes number? They are caused by you eating snacks all day and not brushing." A patient was admitted for anemia and a localized cancer was found. She was referred to surgery so she can get cured from her localized cancer and she started telling everyone that it was the doctors who caused the cancer and that she was doing just fine before coming to the hospital. She lectured the surgeon and my colleague, who pleaded her to get her surgery so that the cancer doesn't advance, and yet she refused, saying she knew better and probably didn't even have cancer. Some people. This kind of reminds me of my brother. He told me that when he was younger, 5 or 6 years old, he thought that when a doctor diagnosed you with a disease, it means that they actually gave you that disease. The only difference is, he quickly realized this wasn't the case and didn't become a freaking idiot like this lady. Nurse here. The number of American 20-something males who don't know what circumcision is ridiculously high. They think that boys are born circumcised. Evidence. New fathers and mothers asking me what's wrong with their newborn son's penis. He still has his foreskin. Many parents choose to have it removed when the baby is a couple days old. It's called circumcision, often followed by a parent's question, "What's circumcision?" That's when I face palm. Dead serious. We talked about circumcision in my grade 6 health class but saw any pictures. I had absolutely no idea until I was in high school. I knew what it was but had nothing to compare it to. This was pre-Google. Was working at a pediatric urgent care. Family brings in their 3-year-old unvaccinated son with autism for a weird rash. They couldn't give me any reason why when I asked them about his vaccination status. Said it before, I'll say it again. Had a patient insist I didn't have a heart attack. I had a myocardial infarction. That's just the technical term for a heart attack. Genius. Patient had an anoxic brain injury from drug overdose. She was 23. Her father demanded a brain matter transplant and oxygen directly put into her brain to fix it. Then he decided they would trash and peg her, send her to a nursing home, and wait for a cure, because we didn't know what we were doing. I was a unit secretary and nurse aide on a radiation oncology unit in the early 2000s. We had a patient show up through the year and was admitted for emergency radiation treatment. She had a massive fungating mass in her mouth that had consumed half her head. When the radonc doc tried to examine her and open her mouth, her remaining teeth fell out into his hand. It had eaten through the bones of her face, invaded her eye socket, everything. Doc said it was the worst case of mouth cancer he'd seen. According to her husband, she had a small lesion on her hard palate, and upon receiving the diagnosis of an early-stage squamous cell carcinoma, she decided to treat with essential oils and things like frankincense because chemo was poison. Her husband said he had tried to reason with her, but she was adamant about the natural treatment. She died in agony shortly after. You know, I usually adamantly refuse to allow my happiness to be disrupted by stuff on the internet. But it's stuff like this that makes me feel justified in allowing myself to be triggered when I see someone I know on Facebook posting horrible misinformation from somewhere like Natural News. ORN here, not a physician, but you may find this interesting. Young adult male presents with multiple abscesses on various parts of his body. States he injected his boyfriend's semen into himself trying to get pregnant. He tells one of the APCs he should have gone with his original plan and tried on his dog first. Psych clears him. He's admitted to the floor and gets IV antibiotics. What? I've seen enough of Reddit today. You have been spotted by the rare flying floofer. If you comment good boy below, he don't steal your hot dogs anymore. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.